are in the facilities. So as part of our model as Ritshidze, we have some recorded community stories, which we record in the community so that they can also kind of share their testimonies and how they've experienced healthcare, as well as having physical community members coming in to share their experiences. So right now, we're just going to listen to one recorded community stories in relation to COVID-19.
Ngo-August ngangaphilile kakhulu, ngahamba ngaya kadokotela. Esikhathi ngifika kadokotela ngendlela engangibambeke ngayo shothi kwangalula ukuthi ngicabange into eziningi. Udokotela wangibhalela incwadi ngaleso sikhathi ukuthi angihambe ngiye esibhedlela because ngidinga i-oxygen. Ngafika ke esibhedlela nga-admithwa, ngalala after 2 days ngomhla 8 kwahlala ukuthi ngine-COVID. Ngabatshela ukuthi ngithatha ama-ARVs kanye namaphilisi e-BP. Bathi-ke kushuthi bekufanele abasekhaya bangilethe, ngabe ngifike nawo noma abasekhaya bangilethele. Ngafonela ekhaya. Uma efika ubhuti wami egeyithini, kuma-security echaza ukuthi ngise-ward 11A, ulethe i-treatment yami. Bathi akuvumelekile lutho olugenayo. Insuku ziyaqhubeka njalo angiyithwali i-treatment yami. Kwaze kwaba ukuthi emveni kwa-8 days ngabuza kudokotela nodokotela engimtshele ofikayo ngiyamtshela ngoba sibona odokotela abahlukene, ngiyamtshela ukuthi ngidla ama-ARVs, ngidla amaphilisi e-BP. Bonke bathi bekufanele ngabe ngiwaphathile. Isimo engangikusona ngangeke ngikwazi ukuthi ngikhumbule ukuthi ngiphathe amaphilisi. So kuze kwaba ukuthi sekuphela u-8 days ngibuza kudokotela ukuthi kufanele ngize mhlambe ngibize ngifake nabanye abantu yini abazokwazi ukuthi bangene lolu daba ngoba sekuney'nsuku sengiqala ukuzizwa ukuthi angikho right ngoba angisayitholi i-treatment yami. Yingalelo langa lawa ngibhalela khona. Esibhedlela ngahlala 14 days but amaphilisi ngawathola insuku eziwu-6. I was supposed ukuthi ngithola amaphilisi zonke lezi insuku eziwu-14. Kwangenza ngizizwe kahle kahle masesibhedlela nje uzizwa umncane ngalendlela lokuthi uma mhlawumbe uthi uyakhuluma ngento mhlawumbe engakuphathi kahle ingoba uzenza ngcono kunabanye abantu noma mhlawumbe ucabanga ukuthi uhlakaniphe kakhulu, kuba nalokho nje okukhona. Ngibe nesikhalazo sokuthi ngidefaultile kanti mina angikaze ngadefault i-treatment yami ngoba ngisengenzela khona ukuthi ngasayina ukuthi ngiyawadla amaphilisi ukuthi this ward is for COVID only and they don't have ama-ARV lie around and waiting for me ukuthi ngifike la ngizofuna ama-ARVs.
Thank you. Bengizocela ukuthi amafoni siwafake ku-silent ukuze angasiphazamisi. And Divuo can continue. Okay, so now we're going to go into our first set of issues within the Ritshidze data, and this is just going to be on staffing and waiting times. So Ritshidze data shows that both patients and facility managers agree that there are staff shortages at clinics. According to 3,436 patients, only 35.2% of patients said that there were always enough staff to meet patient needs. This also varies across the different districts that we monitor in the province, where we had 18% in Utugela, 21% in Gugundlovu, 31% in Ugu, 34% in eThekwini, 41% in Zululand, 49% in Harigwala, and 63% in King Cetshwayo. In terms of the impact of COVID-19, staff at 20% of facilities monitored complained of working with fewer staff operating because of the pandemic, and 12% of patients interviewed also stated that there were less staff working than usual. The next slide just looks at the most understaffed cadres within facilities. So in most instances, when you look at the table, 91 facilities indicated that there's a need for professional nurses, as well as enrolled nurses were sitting at 66, and enrolled nurse assistants are sitting at 53. There also are quite a lot of vacancies or understaffed cleaners in facilities, as well as general assistant, as well as data capturers. We also have vacancies that were reported by facility managers. Facilities in KwaZulu-Natal are performing worst at filling open vacancies, with the highest proportion of vacancies across all provinces. Here we can see which cadre of vacancies were reported per site, and we have the details available of how many vacancies per site on our public data dashboard. Our data shows there's a gap between the staff in place at clinics we monitored, the unfilled vacant positions, and the actual staffing needed to ensure high quality services. And this has only been worsened by COVID-19. Understaffed clinics mean healthcare workers are overburdened. This leads to longer waiting times, limited time to attend to patients, and at times, bad attitudes coming from staff members. These factors directly contribute to people living with HIV starting and staying on treatment in the province. The proportion of men who know their HIV status and are accessing ARVs is much lower compared to women in South Africa. While men account for a third of new infections, they account for more than half of the HIV-related deaths, pointing to a major challenge in men's uptake of HIV treatment services. About 30% of HIV transmission occurs amongst stable partners, and the HIV-positive partner amongst serodiscordant couples, in more commonly male than female. This, together with growing evidence that ART reduces HIV mortality and morbidity, more so if treatment is started early, and potential benefits of viral load suppression in reducing transmission, make men a critical target population to reduce HIV incidence and mortality. Ritshidze data shows that 40% of facilities reported having male nurses and counselors, as well as healthcare workers within the facility. PIPFA should ensure that there is at least one male nurse or counselor at each site to support male uptake of services. Only 30% of facilities said that they had male outreach services, and only 10% had male only after hours clinics, and 6% of facilities said that they had no male specific services at all. We're just going to look at long waiting times, which are reported and established within the Ritshidze data. Patients at 33 facilities reported an average waiting time of 4 hours or more. Patients at 15 facilities reported average waiting times of 5 hours or more. 3 facilities reported average waiting times of 6 hours or more, and 1 facility reported a waiting time of 7 hours or more. The department and the DSPs should focus on the 33 sites and with waiting times of over 4 hours, and try to find out the problem, what the problem is, and try to fix it. We have the clinic names on the dashboard and can provide all this information. So essentially, it is possible to do better. There's 9 facilities that had waiting times under 2 hours in the province. This includes Togazani Clinic, Papamani Clinic, Lamanvul Clinic, and Umlazi G Clinic. And on top of that, on average, people start arriving at facilities as early as 4:30 in the morning in order to be seen first and basically head home earlier. And 24% of patients report that they feel very, very unsafe while waiting for facilities to open at that early hour. "67% of patients interviewed in the province believe that the queues at the facilities are long." Again, this also varied across the different districts, where in King Kechwayo it was at 49%, Utugela at 51%, Harigwala 65%, eThekwini at 69%, and Mgugudlovu 81%, and Ugu at 86%. So the most frequent reason provided by patients for the long queues is that there are too many patients to serve, and this is at 57% within the localities of the clinics. Some indicate that there's just not enough staff, and 47% of patients indicated that. Another reason that is almost always cited is that staff also take very long breaks. This was sitting at 19%. Long waiting times as well as early mornings and feeling unsafe outside the clinic can cause people to feel anxious about clinic days and at times even stop going to clinics. This directly impacts our ability to reach the 95% of people living on HIV on treatment, as it can lead individuals to miss appointments or even disengage from care altogether. Another thing that we look at when we're doing our monitoring is the filing systems. We found disorganized, messy filing systems at 19% of sites. Disorganized filing systems only add to waiting times as staff are delayed in finding files or lose files altogether. Some patients report having to open new files each time they visit the facility, which means that all of their patient history gets lost. What is interesting is that we know that there are 81% of sites whose filing systems were reported to be in a very good condition. What lessons can we learn from those facilities? What systems can be duplicated? It's one of the questions that we should ask ourselves. If other facilities can do it so well, what stops the others from not? The department and DSPs should work together to maintain functional filing systems to improve overall experience of public health care users. So now we're just going to move into some of our recorded community stories, and then we'll also have our community members who are with us just to start preparing to give their testimonies.
Mangifika la ngicela kuze kwaba kathathu ifile ilahleke ingatholakala. Ngoba ngaze ngathetha indaba yamafayili ukuthi na yindaba amafayili njalo yalahleka uma uyile amafayili awuyithola ifayili ayikho. Ngoba ifayili yami nje uma ungayi clinic ufuthi uyoyichecka lapha. Mhlawumbe nginamafayili awu3. Ngizathu ukuthi iyalahleka ifayili ingatholakala ifayili. Kungabibikho indaba yefayili. Ngizofika lapha uthola ukuthi ifayili yami ayikho ilahlekile. Nangempela futhi uthi uyafika lapha ifayili ayikho ilahlekile awuyithola futhi ifayili. So ngempela iclinic yasehlobane ingihlukumezile mina. Angifuni ukuqamba amanga. Izinto bayayilahla too much lapha.
Balungile wakamthethwa enkongolwane Fred clinic engisebenzisayo Hlobane clinic ngidla treatment ye-HIV ngaqala ukuyidla ngo-2010 ngokuhamba ngeenyawo angisebenzi anginayo imali yokuthi ngiye-clinic ngihambe ekuseni ngifike ngabo-8 mangifika ngihlale ngilinde ukuthi ngithole usizo bangitshela ukuthi ifayili yami abayitholi bazothi mabeyithola ifayili yami from 2010 ngiqala treatment ifayili yami ingaka bese ngiyabuza ukuthi ifayili yami iyisiwe kuphi mangilanda treatment bengitshela ukuthi ayikakafiki isikhathi sina manje sebesilethela ngamabox ngikhulume nomunye ubhuti wami inkosi yakamthethwa ngisho ukuthi ngiyahlukumezeka kanje ngesikhathi besinika lamakhadi bathi asibambe queue mele mawufika ukuthi maqeda lo lapha ku reception bese wena uyasondela uthola usizo uhambe ngalendlela basichazela ngayo kodwa kwenzeki lokho masifika fanele ukuthi sibambe line ngathi okay ngathi mangiya 2 months back or 3 months bangitshela ukuthi iclinic ivaliwe kuyacleanwa kutholakala ogulayo nge-COVID. Ngathi ngenze njani ke ngoba phela amaphilisi anginawo aphelile bathi angiye kwenye iclinic noma yiphi eseduze nami ngayibuza ukuthi kanjani ngoba ngihlulwa imali yokuthi ngiye la ehlobane sengizoyithatha phi imali yokuthi ngiye edrobheni okwamanye ama-clinic ngabuya ngasizwa yikho ukuthi ngicele kulaba abanye engibaziyo esidla lawo maphilisi until ngabuyela ngawathola kunebox abalibekayo lapha sibhala izikhalazo zethu sihlale sibhala siyabona ukuthi vele shuthi into abayilahlayo.
Ngisebenzisa iclinic yasehlobane inkinga yasehlobane ukuthi sinokulahlekelwa ngamafayela kusho ukuthi ngo-April ngaya eclinic ngeyifoni yolanda amaphilisi e-HIV so ngathi mangabe ngifika lapha yana kwafika kuthiwa kufanele ngithathe amagazi ngafike ngathatha amagazi ngalelo langa base bethi fanele ngibuye nge-31 sengizothatha ilekhuzane
imiphumela. Mase ngifika nge-31 sengiyolanda imiphumela angangabe ngisayithola ifayela. Lokhu ngifike ngo-7 ekuseni. So kwaze kwashona ngaze ngafika ekhaya ngabo4 ntambama. Lokhu bethi ifayela abalitholi belicinga. So ngaleyo ndlela leyo bangitshela ukuthi ayimanga beqhubeka isikhathi esibona ukuthi ayalitholakala sizokwenzela elisha. Lokho akwangangiphatha kahle ngathi ngangavuma ngathi angeke ngize ngikwazi ukulithatha ifayela elisha ngoba leli fayela engilikwalona leli elesibili. Kanti amafayela alahlwa yini lapha njalo mangabe sesifuna amafayela athiwa wabonakala. Ngase ngithi ngeke ngilenze mina elisha ifayela. Ngicela ningifunele ifayela ngilinde lona bese ngothatha amaphilisi. Bakhane belicingayo ke leli fayela ke laze latholakala ifayela ke ngangikhathi ngihamba ke sengiyobamba olayini njalo. Ngisuka elayinini ngisayobamba ulayini wokuyofutha ngisayobamba ulayini wokulanda amaphilisi. Lokho kwaze kwangenza ukuthi ngize ngifike ekhaya late. Lokho kwangiphatha kabi. Ngaze ngakhuluma vele ngasho ngathi yazi ilento lena ngendlela engiphatha kabi ngayo yiyo lento lena esikhanda ukuthi sigcine sesidefaulter. Ngoba mangabe sifika laphana olwese silahlekelwa ngamafayela izinto azihambi ngendlela but ke futhi mangabe ulahlekelwe ifayela kunakwe abeza emva kwakho wena awulokhu uzokuthiwa nje mana sizazokubhekela ifayela lakho. Lo muntu akabheki le fayela uthatha abalandela emva kwami angithi shuthi mina fanele ngihlale ngilinde. Manje yini into ezongijabulisa ukuthi vele ngoba kufanele vele isigcino kwafanele ngigcine ngidikilile bese ngiliyeka ngiphume ngihambe. Mangabe sengilokhuzane sengiwayeka lamaphilisi ngizothi ngenyanga elandelayo bese bengitshela ukuthi ngidefaultile futhi kanti into edala lokho yilento lendlela le abenza ngayo. Cha bayangisiza ngaleso sikhathi mangabe ngibachazela ukuthi cha kanje bayangisiza ngigcine ngiwatholile. Singacela nje ukuthi ngempela ke bezame indlela yokuthi besikwazi ukuthi besiphathele amafayela nanesikhathi esikhala ngaso ukuthi uma ufika ehlobane uyawashikisha amabhentshi. Yebo ke sengifikile ke emaphilisini inkinga isimile emaphilisini. Thatha abantu abathathu sekuthiwa nje manini kancane. Mhlambe sekungamala useyelantshini setiyeni. Awusazi ke manje usa-understand sis sekwenzakala kanjani. Ulokhu uhle njalo wena uzobuye elantshini phela. Awunalunch wena awunalutho. Fanele ulinde bona beqede. Usuzofika ngobani ke ekhaya koze kushaye kuyoshona ilanga.
Ukuthi wahamba waya ePhaphamani eyofuna egula. Sathi bese siphindela ke udokotela embhukhele i-date. Wangabe salithola ifayela lakhe. Kangawo sasuke ekuseni la. Kwaze kwashaya o3 cinga ifayela. Ngasukuma ngaya kwenye indlu lapha emhlophe ePhaphamani. Angazi ukuthi yani. Ngafike ngabuza hawu. Ifayela likabathi sishandu alikho na. Kwafike kwathi wasuka lapha alikho lapha wahlala lapha amafayela haphindela khona ngale ngaphakathi kwaze kwashaya u3 wagcina usethi ngiyahamba mina ngisafuna sadikila kanjalo ke ngakusasa ngathi siphindeleni mama mhlambe bagcine belitholile wathi akasalibeki ke lapho yena akwazi ngalamba kuze kushone ilanga angaka usesebenzisa ithukuza nje ngamanje sagcina lingatholakalanga nanokuthi akabange savuma ke futhi ukuphindela xasulo ukuthi nje uhlalela ze lashone ilanga. Abavumanga nje ukwenza leli elisha banqaba kwathiwa kufuneka leli elidala. Ngathi ngicela umphathi udololo kwaze kwashona ilanga phathe ngaqhamuka ngagcina nami ngibona nami ngiyahamba mina ngisafuna manje ayifani.
Okay, mina igama lami nguKhosi ngwakanene. I'm HIV. Sukela from 2010 ngilanda treatment yami kaMarey. Ngaqala ukuyilanda singakawalanda emakhontenini. So yabo iclinic yethu ngendlela ephuwa ngayo ayinakekelani. Uyabo nje ulayini subamba ngaphandle. Uzocikeke and abanye abantu ngiyabona ukuthi ngendlela asebe hlala isikhathi eside bengawalanda amaphilisi ngenxa yokuthi baciko olayini lokuvuka ekseni uvukile for nothing uzubuya uma ungifike nje kuyafana nje ungavuka ngo6 uye khona ngo4 uyaphuma abantu nje abasakuthokozeli iclinic yethu and then futhi nje ilindelani clinic so njengoba siselindelani clinic nje siwalanda icontainer incane ayisanele thina abantu abaningi So lapho nje baswalanda kunabantu abe-TB esingena kanye nabo. Ngicabanga ukuthi uTB uyathelelana iyona into esingayinakile leyo sinake uHIV neCovid kuphela into esinakile kodwa uTB wona into esingayinaki kodwa iyona into ebulala kakhulu. And lapho uhlala uzukhohlwe ulinde amaphilisi. Kunabantu abalanda uchronic babogogo. Ogogo babahlanganisa nathi. And kakhulukazi abanaka abantu laba abasuke beqhuga nabantu abangayithandi khona abantu abagulayo kodwa ubona ukuthi okay uyayinukela nabo ba-treatwa kabi unesa akambuza ukuthi njengoba ehamba kanje ehamba ezoyilandela amaphilisi engagezile umbona ukuthi uxakekile akamhlalisi phansi amtshela inkinga yakhe ukuthi njengoba ela uze ngayiphi inkinga and njengoba incane le clinic yethu.
Into engathi yangiphatha kabi ngoba ngumuntu olanda umshanguzo so amaphilisi e-HIV and AIDS so into engayibonayo isineke wasebenzi sincane kakhulu thina njengema-patient wabo so isikhathi masifika ekseni beqeda ukuthandaza siba nenkinga yokuthi sinakwe ngesinye isikhathi seqeda ukuthandaza cishe ngabo 10 ngo-9 qala ukusebenziswa ngathi so uma ngabe siyangasendlini zangasese lapho kwababesilisa uthola ukuthi iphepha langasese alikho endlini yangasese and uthola ukuthi kwesinye isikhathi loba nensipho kezandla asiwazi ukuthi siyithole so lokho kwangihlaba umxhwele kakhulu kodwa ke engakusho ukuthi engathanda ukwenzeke mhlawumbe njengakwaphathi bakhona bekwazi ukuthi bona beqondise mhlawumbe esimeni salaba abasebenzi bakhona bangaphakathi ngoba banomoya ophezulu kuma-patient ukuthi bungathi kunokushoda kwabo khona ukuthi kwesinye isikhathi khona omunye khona umuntu usebenza mhlawumbe amawodi amathathu yokuba igule ey'ntathu mhlawumbe ngapha nangapha nasemaphilisini so into eyinkinga yileyo kakhulukazi engayibonayo and futhi ubuhlungu kakhulu ukuthi bashodile abasebenzi. Into engayizwa ngathi i-complaint eqhamuka kubona ini abaphathi uma ngithi ngifake i-complaint nami ngithi cha nakho unganaki uzoshaya lesi sikhathi so bangichaze ukuthi cha ukushoda kwabasebenzi ngicela sibekezelelane kulokho right noma sesibekezelelene kulokho ke kodwa manje ngiyabuthi lento iyaqhubeka ihlavu iyaqhubeka ekuphathelekeni kabi lokho nje mina ngathi kwangiphatha kabuhlungu.
Okay, now we're going to move on to our community stories. We have 4 community members who are going to be sharing the experiences of the facilities in terms of staffing and waiting times.
Ngiyobingelela umphakathi nabaphethe. Mina ngubongiwe kaJaca. Ngihlala eLindelani. Ngisebenzisa eLindelani Clinic.
Greetings to everyone who are here, leaders and the officials that are present. I'm Lindy Wezaka, Bongi Wezaka, from Lindelani area. I'm using Lindelani Clinic.
Lapha sinenkinga ukuthi silinda isikhathi eside ngaphandle singakangeni ngaphakathi phela ama-hour sisalayine ngaphandle sithi nama sesingene ngaphakathi siphinde sesilayineni kongena ngaphakathi engakaphuma amafayili ngesinye isikhathi amafayili awatholakali mina nje elami lalahleka.
At Lindelani Clinic, we usually wait outside the clinic while we are still waiting to enter the clinic. We wait outside the clinic for a number of hours, and after the clinic is open, and then we went inside the clinic, and then we wait number of hours and couple of hours before the clinic staff or nurse to attend us. While we are still waiting, and they took long time to fetch our files at Lindelani Clinic.
Okay, Manga sengilokhuza sengibuza ukuthi ilikephi ifayili lami njengoba benginefayili lami ebengisuke nalo eNewland West la ngangiqale khona iklinikhi. Mase sengifika la alisatholakali sokuthiwa alikaze libe khona kodwa lafika nami ifayili lami. Ngihlale for 6 months ngilo ngifika bangithethisa mhlawumbe kube khona oyedwa ozadabuka aqabuke nginikile ibhodlela lamaphilisi. Ngesikhathi ngingatholi ngize ngicele komakhelwane.
When I refer back to Lindani Clinic, I referred with my file at Newland West Clinic. And when I asked the one who's in charge of filing, they told me that my file is not in the clinic. And I've waited for 6 months without my file. And I've been waiting at the clinic, waiting for my file, but no one was able to assist me. Sometimes those who have good hearts, staff members, they usually ask me and help me in terms of my medication. But since the whole 6 months, I've never had my medication since that time my file was lost.
Bathi angenze elinye angivule elinye ifayili. Ngathi mina kanjani kade senginefayili elikhulu elimqingo omkhulu. Kanjani ngiqala phansi futhi ngenze lento esengiyenzile. Bathi bona ukuze sikunakekele kuzofanele ukuthi uqale phansi.
At the clinic, they advised me to reopen a new file so that they can assist me while they've lost my file that I was transferred with from West Newlands Clinic.
Emva kwaloko mangaba sengithi ngike ngalahlekelwa ikhadi lami laseklinikhi. Mase sengithi ngiyafika lapha sengiyasho ukuthi lilahlekile ngiphucwe isikhwama. Kube nzima ukuthi ngivulise ikhadi. Ngize ngathola omunye owangisiza wangikhulumela ngoba khona amazinyo ngaphakathi. Kwayimangenzelwa ikhadi. Ikhadi leli laseklinikhi likhipha ifayili. Ngaphuca isikhwama lathathu ahamba nesikhwama. So mangaba sengifika ngichaza inkinga yami. Kube nzima ukuthi bangivulise ikhadi elisha. Ngize ngasizwa omunye ohlobene nongaphakathi wayongikhulumela ukuze ngenzele leli khadi elincane likhipha ifayili.
Then I went back to the clinic to launch my problem that I was met by gangsters, and then they took my card, my admission card, and when I go to hospital, it was hard for me to make a new card for me. And then the only way that I managed to get my card, it was through connection of the person who knows the one who is working in the clinic. So which means that if there's no one that you knew in the clinic, you weren't able to get assistance.
Enye into esinenkinga ngayo ngaso sonke isikhathi bathi bayashort, siyashort staff. Namhlanje nizolinda ama-awana bekezelani siyashort. Zonke insuku kuhlezi kunjalo. Asazi ukuthi kungani behlezi bekhala ngestaff. Sinenkinga enkulu kakhulu impela.
And also the shortage of staff at Lindani Clinic. They always complain about the shortage of staff, and then they ask us to be calm and wait until the nurse that is on duty on that time, he or she will assist you. They always beg us to wait and wait and wait and wait. Thanks.
Ngiyabonga.
Sanibona, igama lami nguSinethemba ngwaMkhize. Ngiphuma eLindelani Clinic.
Greetings, everyone. My name is Netemba Mkhize from Lindelani Clinic. I'm using Lindelani Clinic.
inkinga esibhekene nayo elindelana ikliniki kaMarie ukuthi mawufika ngaphandle mawufika egate kuthiwa ningangeni ngaphakathi imani ngaphandle nibamba ulayini.
The issue that we face at Lindani Clinic is that when we came to the clinic, they told us that we must remain outside the clinic, waiting on the queue until someone asks you to enter the premises of the clinic.
Bathi sibe ngaphandle ukuze singathelelani ngeCovid-19. Kodwa futhi mawuthi uthatha ukubheka wona lo line lo ngaphandle ayikho social distance, sanitizer kwamana kusungena usuhamba uyothola isizo ngaphakathi.
They told us that we should wait outside the clinic because they don't want the patient to transmit the COVID-19 to them. And even if we are still waiting outside the clinic, there's no social distance, there's no one who sanitizes us while we are still waiting outside there.
Ngalenkathi simile futhi ngaphandle uma mhlambe 4 hours wonke ungangeni ngaphakathi ekliniki. Mawuthi uyabuza ukuthi indaba singangeniswa thiwa asilindeni sizobizwa. Lokho ulindile ke uzugcina usufuna ukuhamba ungalitholanga usizo.
We at Elindilani Clinic we stay outside the gate for more than 4 to 5 hours without any assistance until someone calls you to come in the clinic. We wait a couple of times without any assistance.
Ukufakazela lokho engikushoyo kukhona nje ngelinye ilanga omunye usisi owesemva kwami ehamba nogogo ebambelele kuyena kusho ukuthi engakwazi kahle ukuyimela.
To confirm what I said, there was a patient who was accompanied the grandmother who was standing outside the clinic, who was suffering a lot, and then they've waited outside the clinic with the old woman on the queue. And they asked me to go and ask the staff to help Ukoko, the grandmother, to provide him with the chair so that he will rest while we are still waiting on the queue. The security told me that why your grandmother is special. He is not special here. He must join the queue with everyone. As we know, with some procedures, especially in government institution, old people, they don't wait on the queue. They just went straight to get services. But at Lindani Clinic, that one is not implemented. Unfortunately, the granny was having epilepsy, and the epilepsy, and he got an attack of epilepsy while she was waiting on the queue, and then he suffered on epilepsy until he hurt himself.
So, into advise ngayo mina ukuthi abanakekela abantu abadala bebangenise ngaphakathi noma singama-ke ke thina kodwa futhi ayikho right lento ukuthi sime ngaphandle kumele sonke singene ngaphakathi benze indlela ukuthi kube nezitulo yonke lento.
My advice is that the clinic of Lindelani must consider elderly people first and provide chairs for them while they are waiting for services.
Nabasebenzi mele be-add on nurse bakuthiwa bayashoda every day kushoda nurse ulokhu ulindile.
And the clinic must ensure that they add more staff so that the services will be on the level of what the patients wanted.
Igama lami nguZanele Magwaza. Ngizokhuluma ngesiboniso clinic eSikhawini ngaphandle kwesikhawu kodwa.
Greetings to everyone. My name is Zanele Makwaza from Eskawini. I'm using Siboniso Clinic.
Esiboniso clinic lapha basebenza onesi but kodwa abayenzi into fuze ngabe bayenza, sihlala isikhathi eside kanti siyavuka ekseni masihamba nezingane siyahlaliswa bethi basabamba imeeting, abanye bethi basenza iti ekseni ngesikhathi sokuthi fuze ngabe bayaqala bayasebenza.
At Siboniso Clinic, there is staff and they are working, but the problem is that they are slow. Sometimes they told us that they want to make tea first, and when we go to clinic Siboniso to get access at Siboniso Clinic, they told us that we must wait for some times, and then we decided that we felt that the clinic it's making our services more slower than ever, because we don't know that because the staff is there.
Ngelinye ilanga ngathi ngiyahamba ngithi ngiyofuna ukuthi bengishintshe umjovo because umjovo lo engangiwusebenzisa ka 3 months nganginenkinga wangophisa kakhulu. Mangithi ngiyafika ngingene ngaphakathi ngicela ukuthi ngizoshintsha umjovo, bekutshela ukuthi awekho amaphilisi because ngase ngifuna ukushintshela emaphilisini. Ngase ngiyabuza ukuthi ayikho yini eminye imizamo abangangenzela ukuthi bengakwazi ukuthi bengisize ngayo yini. Bathi cha angibuyele kuwo lowo mjovo lo because bayasho ukuthi lokhuza amaphilisi awekho, ayikho nabo into abangayenza.
I went to the clinic to change my contraceptive from the injectable to tablets. So they said that there is no tablets for my contraceptives, but they said that I should continue with the injectable ones for 3 months.
So besicela ukuthi bekwazi ukuthi belokhuze besheshe besikwazela ukuthi odele izinto esisuke siyidinga eclinic because sibaningi isikhala ngento efanayo.
So my plea is that they should provide all contraceptives at the clinic so that we were able to access all those contraceptives.
Ngiyabonga.
Yabo, thanks.
Sanibonani endlini. Mina ngiqhamuka eKwaMaritzburg. Iklinikhi engiyisebenzisayo iklinikhi yaseWillofontein. Kule nkinga yokulindiswa ngaphandle ngeke ngisalanda kakhulu ngoba kusho ukuthi same story same all place, ngoba even eMaritzburg nakhona senaleyo nkinga kulo maklinikhi akhona. Bese ukuthi ngoba noma usungenile ngaphakathi usayolwenye impi futhi nonesi bakhona. Mina ngithola ukuthi bengikade ngi-HIV positive, nginenkinga ye-arthritis, ngine-BP. Ngaphinda ngazowa esitebhisini ngisebenza ngalimala nganqamuka inkomishi yedola. Kusho ukuthi icala lami kwaba yilelo ngoba kutheme sebebona kuleli clinic engiyisebenzisayo ukuthi sengihola ipension yokulimala. From that day file yami yalahleka.
Ubaba is indicating ukuthi
Kusho ukuthi ilahleka ngoba khona omunye kufanele akwenzele ipension ngayo ngoba mayise ibuya upink card ebengivuselela ngayo ipension wangasekho. Ipage le medication yami la engasekho.
Greetings to everyone. My name is KZN Department. I'm using Pietermaritzburg Clinic. I think the stories are similar with my story, but anyway, I went to my clinic for
HIV.
for pension review. When I went there, the one knows that I've already got the pension, so they took my file to help someone to register the pension with my file.
Kusho ukuthi emva kwaloko mayisibuya ifile engasaphelele from there until now. Makufanele ngolanda amaphilisi ngiba nenkinga ngoba fanele everyday ngiqale phansi ngichazele unesi oqashelwe ukuthi asize mina. Ukuthi imapha amaphilisi engiwadlayo otherwise uvele banginika amaphilisi wrong.
Since then, my file was lost, and I realized that the file that was meant for me, it was changed to someone else, and then that someone else went to SASSA to register using my file with all my document. When I go there at the second time, they told me that my file is here, but a couple of papers, a couple of documents were not there. They were taken away for some corruption doings.
Bese ngicela ukuthi i-department ke ikusukumele lokho ukuthi indlela yefiling emakliniki kibe safe for thina ama patient ngoba sogcina sibulewa amaphilisi wrong. Ngiyabonga.
So the issue is
We would like to appeal to the Department of Health to assist us with the filing systems because this impacts negatively on us because at times they would then administer the wrong medication because we have to explain to healthcare workers which medication we are taking instead of them readily knowing from viewing our files. Thank you.
Thank you very much. Now we, we are going for recommendations. By May 2022, the KZN Department of Health should fill 80% of vacancies in the province and fill remaining 20% by August 2022. By May 2022, district support partners should ensure all PEPFAR-supported sites have at least one male nurse and male counselor in place, leading a greater uptake of services by men. By December 2022, the KZN Department of Health should employ additional 15% of nurses, including professional nurses, enroll nurses and enroll nurse assistants in eThekwini, Herikwala, King Cetshwayo, Ugu, Umgungundlovu, Uthugela, and Zululand, and employ additional 10% of data capturers in Ugu and Umgungundlovu. The KZN Department of Health should produce annual reports on the numbers of healthcare workers employed in each district. By the end of 2022, they ensure a functional filing system in most of the clinics that are listed there. I mean, I won't name them. And also by 2022, they should extend opening hours as per National Department of Health circular from 5 a.m. to 7 p.m. on Monday to Fridays. By May 2022, open the ground of the clinics by 5 a.m. to ensure safety of patients waiting to access services in the early mornings. By May 2022, implement functional appointment system at 100% of sites and ensure that patients are aware of them. The KZN Department of Health and district support partners should work together to reduce the burden on facilities by getting at least 60% of people living with HIV out of the clinics into the external pickup points or community adherence clubs. So now we are going for infrastructure and cleanliness. Simpiwe will be assisting us.
Thank you, Chairperson. Positively, 84% of clinics monitored in KZN were in good condition, better than most other provinces. When we talk about a good condition, we look at the general condition of the building, if there are broken windows, broken doors, and if the building is well kept. This did vary across districts, with 33% bad condition in Utugela, 19% in eThekwini, 13% in Umgungundlovu, 9% in Ugu district, 8% in King Cetshwayo. Positively, all clinics in Herikwala and Zululand were in a good condition. In terms of cleanliness, 80% of patients reported that facilities were very clean or clean, which is very positive. And this also means that there is a hand wash soap available for patients in the toilets. Only 2% of patients are reported clinics were very dirty or dirty. 102 facilities had 0 reports of being dirty by patients. In order to get all clinics meet high standards set out by these 102 clinics, the department should fill all cleaner vacancies reported in the province. 88% of clinics report that they need space for something. This varied across districts, with 94% in eThekwini, 93% in Umgungundlovu, 91% in Ugu, 89% in Zululand, 83% in King Cetshwayo, 79% in Utugela, and 40% in Herikwala district. Most commonly, 87 facilities need more space for patients to wait, 76 facilities need space for HIV testing and counseling, 71 facilities need more room for medical care, 74 facilities need more room for filing, and 62 facilities need more space for storage. Almost half of the toilets were reported as being in a bad condition. Mostly, toilets did not have toilet paper or soap. 39 had no soap and 26 had no toilet paper for patients. 12 clinics had broken toilets and another 22 were dirty. It is a basic requirement for clinics to have a functional toilet at the clinic, with community members having the ability to wash their hands afterwards. 58% of clinics monitored had toilets in good condition with no challenges. What are they doing right that the other clinics can learn from? The department should prioritize getting the remainder of the toilets into a clean and functional state. We will now move on to the recommendations.
Thank you, Simpiwe. The recommendations are by December 2021, all patients should be consulted in private room, facing violations such as being consulted, tested, or cancelled in the same room as someone else can lead to HIV disengaging from care. By May 2022, the Department of Health in KZN should fill all cleaner vacancies to ensure clean facilities and toilets. By December 2022, the KZN Department of Health should employ an additional 15% of cleaners in Umgungundlovu, Herikwala, and eThekwini. By December 2022, the KZN Department of Health must implement strategies to address infrastructural issues, small waiting areas, space for filing systems are too small. Now we are going for art collection, and Ndivuo will lead us on the presentation.
All right, so we're going to now look at art collection. So the revised National Adherence Guidelines Standard Operating Procedures note that time constraints are a challenge to many patients, and that efforts should be made to support people living with HIV with suppressed viral loads to receive extended refills or be enrolled in a repeat prescription strategies. Implementing this is vital to supporting improved long-term adherence. Ritshidze data shows that 54% of people living with HIV reported receiving 2-month ART refills. Only 29% of people living with HIV reported 3-month ART refills, which, while higher than other provinces, is still low as the country aims to move towards longer multi-month dispensing. Furthermore, 15% of people living with HIV still reported refills of 1 month or less, when South Africa's national policy standard is for 2 months. 69% of people living with HIV interviewed through Ritshidze received less than 3 months of refills, compared to only 25% of people living with HIV supported by PEPFAR in other countries receiving less than 3 months. Between October and December 2020, in 21 PEPFAR-supported countries, 22% of people living with HIV received 6 months out refills, and 53% received 3 to 5 months of art. This is compared to only 29% of people living in KZN reporting a 3-month art refill, and 2% of people living with HIV interviewed reported receiving a 6-month supply. While doing best among provinces, KZN is still lagging behind in implementing multi-month dispensing compared to other PEPFAR-supported countries. So the table shows facilities with 8 or more reports of a 1-month supply of ARVs. We acknowledge that at times there is a clinical need for someone to get a shorter supply. However, in this table, you can see as many as 8 or 10 or even 19. Actually, the highest is 27 reports of 1 month supply. This points to a possible challenge with stockouts or shortages of ARVs, or other issues at the facilities that need to be investigated urgently. Unnecessary trips to the clinic just to collect an ARV refill adds both on to the burden of a person who's living with HIV and also to the already overwhelmed clinic and healthcare worker staff. This inefficiency can also contribute to people living with HIV disengaging from care directly, impacting the province attainment of the 95% of people living with HIV on treatment. Extending treatment refills or multi-month dispensing is one strategy to reduce unnecessary burdens and support both people living with HIV and the health system to be more efficient. So another report from facility managers is that only 76% of facility managers said that they were giving 12-month scripts for people who are people living with HIV who are stable. This is important as we move towards multi-month dispensing, as it means that those people who are living with HIV are able to reduce the number of trips to the clinic, with only 1 annual trip to the clinic to see a clinician required, and also allows them to get longer refills. All facilities should be giving 12-month scripts out in line with the government gazette on the 12-month art scripting in 2020. So let's just touch now a bit on repeat prescription strategies. So repeat prescription strategies, including internal and external pickup points and adherence clubs, should be much simpler and quicker systems to collect ARVs than waiting in long queues. Almost half of the people living with HIV who we interviewed in our sample collected their medication at the facility through a standard medicine dispensing. 33% used an internal pickup point and 14% used an external pickup point. In order to be effective, repeat prescription collection strategies should make ARVs collection quicker, easier, and more satisfactory for people living with HIV. So out of the 1,041 PLHIV interviewed using an internal pickup point, 95% thought this made the ARV collection quicker, and 92% were either satisfied or very satisfied. This is positive and shows the pickup points are working. Out of 434 people living with HIV, 100% thought external pickup points made ARV collection quicker. 97% of people living with HIV were either satisfied or very satisfied with external pickup points. Given the satisfaction rates, it is important to ensure that as many stable people living with HIV as possible are enrolled on the repeat prescription strategy, with at least 25% of those being put in an external pickup point. Now let's touch a bit on adherence clubs. So a key takeaway with adherence club, it seems that a lot of people are generally satisfied with an adherence club or with the club that they are in. This is good evidence that we need to support, there's a need for more support in terms of adherence clubs. However, some clubs at some facilities have been suspended during COVID, also due to the COVID pandemic. Of those not in clubs, 42% of people living with HIV weren't even aware of what a club is. It's important that we talk as the PLHIV sector and and also include the department to ensure that clubs can be run safely while ensuring access to peer support and treatment literacy information. So the department, working together with the PLHIV sector, innovative ideas can be come up with in order to ensure that adherence clubs are safe, they are a COVID-free environment, but they also provide the necessary treatment literacy as well as literacy classes that are needed by people living with HIV. More than half of people living with HIV who we spoke to, 54%, wanted to collect their ARVs closer to home. So essentially, we should be decanting more people living with HIV to external pickup points, which are closer to their homes. Here's just one example of a community member who told us the benefit of collecting ARVs every 3 months, and this was basically reducing their interaction with the clinic. By getting more people living with HIV out of the clinic, we will ease congestion, shorten waiting times, and ensure fewer trips to the clinic for people living with HIV. All this will help us to keep more people who are living with HIV on treatment. So if you just look at our slide there, we just have a little small case study about Nomcebo, who's currently on a 3-monthly script for her ARVs, which has been a small relief for her. Because each clinic visit is basically like a small, like a bad dream. So being able to collect her ARVs after 3 months is a bit of a relief that she doesn't always need to go there every single month to be collecting her treatment. So now we're just going to move on to some of our recorded stories, and we also have 2 community stories in the tent.
Ngolakho akogede mina sisi. Iklinikhi engiyisebenzisayo ihlobana. Anginayo futhi nanemali yokugibela. Lokho nje ngoba angikhoni nanokuthola imali ngoba ngisebenza. Naseka ngihlalela ngedwa. No ukuthi ngibe nendlela yokwathola eduze. Hayi ukuthi ngiyanqana ukuyisebenzisa treatment. Hayi abafiki. Anokufona baza ngabefona. Ngabanikeza i-address e-right nefone e-right kodwa bazama befika. Angifeli right njengamanje.
Kuba u3 months mina ngiwathathayo ngoba sengaba step down kwenye church. Church angifuni uqamba manga kuyashesha ngoba ufike ukhiphe nje ikhadi lakho bekunikeze bengene ngaphakathi bekunikeza usayini uyaphuma uyahamba. Awubi khona ulayini. Uhamba nje kancane ngenyawo bese uyakhona ukufika ngoba abanye bayasonta khona vele kule ndawo. Ngabona kungcono kube se-church ngoba esinye isikhathi imali angibe nayo. Iklinikhi kuqhelile kunathi. Sihamba intaba sole kancanana lesasihosha bese sikhane sifike eklinikhi. La e-church silanda khona amaphilisi kuseduzane. Siqanja umfula swele ngaphesheya sesifikile. Shuthi ngisho ukuthi bengacela eklinikhi ukuthi belethelwe ilezi imoto zakhona eklinikhi noma besondezele khona emasontweni khona kuzoba ngcono. Ngoba zikhona imoto uma ungasakhona vele ukuhamba. Khona imoto ezifikayo ziyakufonela before bese ziyakulethela.
Ngubheki wakamkwena. So nginenkinga ngiphuma eloko eJozi. So manje ngifikile ngoJune laphana ngiphuma eloko igazi ngomlomo nami ngamakhala. Mangifika laphana eloko iclinic yalana eloko abazange bang-attend. Ngizwa ngixeka Nkosi yami bangangamukela. Ngahamba ngabuyela emuva ngabuyela back. No bathene kufuna ukuthene ngihambe ngiyolanda ilento incwadi yale eDon Park eclinic eJozi. Ukugula kuphatha manje and then ungeke ukwazi ukuyolandela and then ngeke ngibuyele lokho and then imali ayikho angigxeki yona kodwa manje yangiphatha kabuhlungu. Ngabuya futhi ngacela ukuthi ngiyaxeka manje ngiphethe iTB and HIV mina amapilisi engiwaphuzayo abazange bangathende. Ngahlala 2 months ngixeka lana ngaze ngaboleka imali laphana bangithatha bangibuselelele kwemuva ngabuyela futhi ke ngathatha transfer ngifike ngabanikeza. Kungiphathe kabuhlungu yangihlumeza le clinic mama yangihlumeza kakhulu. Yasinhlisa kabuhlungu nje. Asikise apologize. Ngiyaxolisa ukukhuluma lokho. Angakubhadali namanje angisebenza ngithi ngisafuna umsebenzi angaze ngibhadale imali nix namanje nje bayifunele imali zabo ngisathi ngizama amatoho next amatoho angaze ngibhadale nix. Yabo.
Clinic esihamba esePhaphamani Clinic. Usuke ehambela ukuthatha lamaphilisi lawa abadlayo. Ngihambe ngiyomlandela bese mase ngimlandelile mase ukuthi sebefuna yena shothi ukuthatha amagazi behambe singimhambise eclinic ukuthatha amagazi ke so khona ngelilanga esahamba sakhona sahlala usuku lonke naye engekho right sahlala usuku lonke nje ngangena phansi ngicela ukuthi bengingenisele yena base bethi akabamba ulayini kodwa evele ebonana ukuthi akekho right. Isizothatha amagazi mangabe ke sekufanele sigeneke ngathiwa ngazi unesi usasetiyeni noma usekanjani akisilinde salinda sahlala sekazowashaya u3-4 lokhu sifike ekseni ngo5 basiphathanga kahle ngalokho eclinic. So ke ngoba ngisho makuthiwa ngiyomthathela banakho ukuthi bafuna yena ngaso sonke isikhathi masefika futhi befike futhi bengama-attend ngesikhathi bese bema-attenda ngaso kanti manje akekho right ukuthi ngalokho ehambele uyithathela amaphilisi. I-treatment ayithatha i-HIV ukwenzeka kwalento lese mhlawumbe sekwenzeke sokuze kwaba kathathu makufanele ngiyolanda amaphilisi akhe manje asazi noma kuguliswa yikho yini lokho ke noma kodwa ke uvela wavuvukala inyawo wavukala izandla wangakhona ukuhamba uyatotoba nje sekungcono manje uyatotoba bade ngahambi semqukula samisa khona eclinic iKuthangi masifike eclinic iKuthangi sisocela ukuthi bemfake idrip ngoba manje asazi noma ilokhuzana amandla sephelile noma kwenzakalani base bathi bona ngeke beze bemfaka umuntu idrip ngeke beze betshelwe ithina ukuthi sizobatshela bona manje umsebenzi wabo ukuthi kufanele sothi sizocela idrip ayicela ibona ababona ukuthi kufanele bemfake idrip. Abachaza abaze bemcheck ngisokumchecka nje sangangena egumbini labagulayo ngena naye simfake sama-wheelchair base beza ukuthi mina ngizocela idrip base bangamchecka ke bangenza lutho uvele nje akubuka nje yana ufuna uhlalele kude naye akaku-attend akakho ngisho amaphilisi akunewona makuthiwa ena uyagula uyamchazela vele akubuze ukuthi yini inkinga yakho bese uyasho ukuthi yini inkinga yakho bese vele lokho ebhala into eziningi esingazazi bese vele kunika amaphanado. Mina nje kodwa ayikho impatho lapha kuleya clinic leya
mangabe uzoshesha ukusheshisa ukubhaliswa Ngoba into edileya kakhulu indaba yokubhalisa. Ngithi awungeni ungabhalisile. Baqala bethi kulayini yokubhalisa bese uya kulayini loze abagulayo. Kuyadileya-ke lo osuke ugcwele impela lokubhalisa. Sometimes bese baya etiyeni behambe bonke. Hamba sohlala noma 2 hours. Lokhu ehleli bengabuyi. Size sibone ngabo-ke mase bebuya-ke. Bethanda ukubuya. Kodwa nje isikhathi abasigcini isikhathi 2 months. Ayisengiphelele. Kanti kufanele ngibuye ngizothatha igazi. Wathiwa ena sizokunikeza leli elilodwa elokuthi ena uliphuze namhlanje. Ebese uyabuya-ke uzothatha amagazi and then uzowathola amaphilisi akho. Agcwele. Abachazi nje. Bayathi ngihambe uthatha igazi. Mhlawumbe bethi ngoJuly. Order once ethi ngoJuly uzobuya uzothatha amagazi. Uthatha amagazi-ke. Qala emagazini bese bekunikeza i-treatment. Emveni nalokho-ke bese bekunika i-date yokubuya-ke. Uzolanda-ke futhi amaphilisi.
Kodwa bakhombisi wena. Balifaka efayilini bengakutshengisi wena ukhona uzobona wena ukuthi ukuhamba impilo yakho ihamba kanjani. Bona vele benze nje bese befaka efayilini ifayili futhi ihlale futhi kubona.
Iyafana, ngithi iyafana. Noma kushintsha ama-container. Yabo khona ama-container amhlophe na-blue. Kodwa iyafana mangibuka phakathi. Ahlezi beshintsha nje.
Bamnika leli mhlophe phinde bemnikele i-blue phela
ngithola ngize ngibuze khona ukuthi awuseyiwo njalo lawo. Kuthiwa yiwona.
No, and ama-ARVs. Ngingasho ukuthi i-right i-service yama-ARVs ngani ngoba eklinikhi noma kukhona lokho okubi kodwa kuba khona okuhle. Njengoba bene-program, I think it's a pilot program or what, ngicabanga into kanjalo noma ngasakhumbuli kahle. Yona i-right course ngoba mangabe bekufake ku-fast lane uyakhona ukuthi uthole i-SMS efonini yakho uhambe ulanda amaphilisi akho ngaphandle kokukhipha ifile, ngaphandle kokukhuluma nomuntu oseklinikhi. Uvele ushaya emshinini kuvuleke ukhipha amaphilisi akho and then uye mase uyovuselelakhe. Inkinga iba lapho-ke ngoba kunama-long queues, uyahlala isikhathi eside. Uyafika nje ngo-7 ekuseni uyahamba nango-8 ebusuku noma ngo-7 ebusuku.
Now we're going to have our community stories. I believe we have got 2 stories in the tent.
Sanibonani.
Greeting.
Yebo, igama lami uNokwanda Mlungwana. Ngisebenzisa isiboniso clinic Mabuyeni.
I use Boniso Clinic in Mabuyeni area.
Inkinga esinayo lapha esiboniso thina njengabantu abasha.
The problem that we experience at Boniso Clinic as young people,
Khona amaphepha lawa abanamathiselayo asitshela ngama services abantu abasha.
there are posters displayed that explain about the services for you, specifically for youth.
Yes, lawa ekuthiwa i-happy hour. But mase uqhamuka ngabo 2 uze kuyo le happy hour le abakhuluma ngawo kuba ngathi abekho aware because baze besibuza ukuthi yindaba ufika late kanje. Mhlawumbe
The services are happy hour services. When you inquire and you come at the designated time that is displayed on the poster, they still will ask you why are you coming to the clinic that late, whereas the poster says it's between 2 to 4.
enye into esibuye sibe nenkinga nayo lapha ekliniki abasathandi ukusebenza ekseni.
We also have experienced that the clinic staff do not want to work in the mornings.
Yes, ekuseni ufica kugcwele baqala ukusebenza kahle laphana ngabo 12.
In the morning, the clinic is overcrowded and they only ever start working around 12 noon.
Yes. Into enhle ke ngayo ke isiboniso ama-male nurse akhona.
What is good about Sboniso are the male nurses.
Yes, ama-male nurse shem asiphatha kahle lawa qashiwe nje. Asiphatha kahle ama-male nurse ayasichazela umehluko ngisho uzopreventa bayakutshela ukuthi izinhlobo zakhona nje yini ekhona ngisho amaphilisi abakuniki nje iphilisi ongalazi.
So the male nurses treat us very good.
Yes.
They explain if you have come for contraceptives, they give you the different options, they explain to you the side effects, and they never give you anything without explaining.
Yes, sicela bebe khona nje bengabaxoshi.
So they must remain in Sboniso, they must not move them.
Thina lapha eklinikhi Siboniso sinenkinga yokuthi uma umuntu ozolanda amaphilisi kuye kuthiwe fika early. Uma usufikile kube ukuthi abakwazi ukuni-addressa ngendlela efanele. Kwesinye isikhathi omunye uze afise ukujika.
At Sboniso Clinic, we experience that we arrive early at the clinic, and when you have arrived, you sit for a long time without being attended and wish to go back home empty-handed.
Okunye abahlupha ngakho ile meeting abayibamba every day ekseni. Singayazi ukuthi yani kuze cishe kuphele almost 2 hours.
What bothers us is the morning meetings that they hold every morning because they are lengthy, usually last about 2 hours.
Ngesikhathi sebebuya kusuke kusasebenza unesi oyi1 unesi Mabaso kuphela.
When they come from the morning meeting, only one nurse, which is Nurse Mabaso, works, and then the rest don't start working as yet.
Nale yokufika kadokotela kuye kuthiwe uma uze kudokotela afika earlier udokotela ezoyifikela ngo9 kanti akisi isikhathi sakhe sokuthi afike u9 agcine efika ngo10.
When you are booked to see the doctor, you are usually told to arrive early, but the doctor then arrives around 11, 12.
Ilonto esihlupha kakhulu eSiboniso Clinic.
That is the challenge we're experiencing at Sboniso Clinic.
Thank you. And the recommendations are, from November 2021, the KZN Department of Health should retain the government gazette 12-month scripting and implement the March 2020 revised standard operating procedures on repeat prescription collecting strategies. By November 2021, the KZN Department of Health and DSPs should ensure that no person living with HIV ever receives less than 2 months of supply of ARVs as per national policy standards. By May 2022, the KZN Department of Health and DSPs should extend and implement ARV refills to at least 3 months supply for all eligible people living with HIV. By December 2022, the KZN Department of Health and DSPs should extend and implement ARV refills to 6 months supply for eligible people living with HIV. By May 2022, the Department of Health and DSPs should ensure that 60% of people living with HIV in the province are using a repeat prescription collective strategy, and at least 25% of those people living with HIV should be accessing treatment from the external pickup points. By May 2022, the DSPs and KZN Department of Health should ensure all facilities are registered on the CCMDD program. 804 facilities as of July 2021. By May 2022, the SPs and the KZN Department of Health should establish at least 2 external pickup points at each site in order to provide greater access to refills closer to home at more convenient location to people living with HIV. So we are continuing with Art, and Simpiwe will be doing the presentation.
Thank you, Chairperson. The next group of issues are on art, as the Chairperson has stated. People living with HIV had complicated lives and may well miss appointments and even miss taking some pills. When they do, meeting with support when they return to the clinic helps ensure long-term adherence. Yet, poor staff attitudes coupled with unwelcoming services remain a key challenge. That means people living with HIV have stress and anxiety about going to the clinics or stop going altogether. For example, only 75% of patients thought staff are friendly and professional. Most people we spoke to had never missed a visit to collect their ARVs. But out of the people living with HIV who had missed appointments, people living with HIV at 38 clinics monitored said they are shouted at the next time they come. At 33 clinics monitored, people living with HIV said they are sent to the back of the queue next time they come when they have missed their appointment. The department and district support partners are meant to be implementing welcome back services, but this issue is still persistent. But we also have positive findings. At 80 clinics, people living with HIV said they are welcomed back the next time they return to the clinic. Positively, 97% of people living with HIV feel that facilities keep their HIV status private and confidential. 97% of PLHIV we spoke to had gotten a viral load test in the last year. However, many do not really know what the results mean. The top 2 graphs are the results from when we asked people on treatment if these statements were true. 89% agreed with the statement. Having an undetectable viral load means that the treatment is working well. But only 80% agreed with the statement. Having an undetectable viral load means a person is not infectious. Also, only 89% of people living with HIV said that a healthcare provider had explained the results, showing an obvious correlation between education and understanding. The districts that performed worst were Ugu, where only 73% of PLHIV said a healthcare worker explained the results, followed by Zululand with 76% and Herikwala sitting at 83%. We will move on to our recorded community stories.
Ngihlala eNkongolwane number 2. Iklinikhi engi-athendayo ihlobane clinic. Ngike ngaba nenkinga ngoJune bangishintshile ngidla amaphilisi e-HIV. Bangishintsha ngoJune bathi bangishintsha amaphilisi. Then kule nyanga ngeyi6 ngiyile clinic ngayobatshela ukuthi ngibona ngathi ngiyancipha emzimbeni. Into enzekile akaze baze bathi serious inkinga yami. Baqhubekile banginika amaphilisi wona la ebengikhala ukuthi ayangihlisa emzimbeni. Yilokho nje okuyinkinga. Bangitshela ukuthi amaphilisi amasha afikile wonke umuntu uyawashintsha. Ayikho icho senginikwe yona. Bengilindele ukuthi inhlabe khona bangakwenza bangibatshela nase angikhona nokudla ngivaleka ngisho inhliziyo. Angitholanga ngisho amaphilisi okuvula inhliziyo, angitholanga lutho. Baqhubeka banginika wona lamaphilisi. Yiwo la ngiwadla namanje la ngithi ayangihlisa emzimbeni. Ngiyacabanga ukuthi nje ngivele ngiye ngcono ngawaphuzi. Ngivele ngcono ngihlale ngawasebenzisi. Ngiyabona ngathi nje usho ukuthi ena bangibukela phansi abanandaba nami. Ngibona nje lokho ukuthi abanandaba nanempilo yami banandaba nayo. Bengi-right nje. Nasemzimbeni ngi-right ngidla ngingenankinga. Inkinga iqala manje kulamasha la esengiwasebenzisa. Mina ngifisa ukuthi ngathi bengangithatha amagazi ba-check ukuthi kungani anginciphise bangishintshe amaphilisi alungele umzimba wami. Banginike amaphilisi a-right for umzimba wami.
Ngihlala ehlobane enkongolwane number 2. Iklinikhi engiyisebenzisa ngisebenzisa ihlobane. Nazo ehlobane ufika ngesikhathi kodwa ulinda isikhathi eside uzohamba late. Okunye esibhekana nakho sekukaningi ngihambisa umntwana eklinikhi ifile kuthiwa alahlekile amafayili kwaze bathethe umphathi kwabeke kukhani belisukumela lolu daba lamafayili alahlekayo bakhani sebecinga sekusho umphathi. Okunye enginobhekana nakho enginokureporta futhi khona eklinikhi njengoba ngi-HIV positive kuyenzeka kwesinye isikhathi benginike amaphilisi angangiphathi kahle and ne-container ishintshile and negama le-container alifani nale ade ngaphuza. So ngibatshene bethi haya aweze ukungenza lutho i-container kuphela ishintshile. Ngithi negama lishintshile bethi haya angeke eze ngiphathi kabi. Noma ngabe kuthiwa ngiyeza ukuthi angiphatha kabi kodwa bethi hayi ngeke eze ngiphathe kabi. Nami ngokuthi ke umgomo ubekiwe ukuthi mawukulenkinga mina ngibhekene nayo angeke uzuthi uyaweqisa uyayeka kumele uwaphuze. Ngenze sho ke ukuthi ngiyawaphuza. Enye inkinga engibhekane nayo ngaze ngaya esibhedlela. Esibhedlela bathi abanginikeza amaphilisi einhlungu for operation ngoba iyahlupha ngoba ngaqeda ngoperation. So ehlobane bakhona ukuthi benginikeze kwesinye isikhathi ke ngize ngiwathole la kwi-mobile. Nemithi lo sukuyicela awuyitholi. Kwesinye isikhathi besihamba uyithenga ekhemisi. Ukuthi nawe ke mungenayo imali kwesinye isikhathi uyahlala kulinde ke mosunayo uzoyithenga lo mithi le ekhemisi. Ilokho mina engikhala ngakho. Okunye nje ngifisa ukuthi ngithanda ukuthi ngathi bengashintsha indlela abaphatha ngayo abantu. Bazi ukuthi singabantu njengoba nabo bengabantu. Bazi futhi ukuthi ubhlungu ngendlela abasuke besitreatha ngayo ukuthi buyezwela ngoba nakubo bungazwela. Ilokho nje ngikushoyo.
Oh cha, ngithi mina sinenkinga lapha kule clinic le. Nami kade ngafika lapha kule ndawo kodwa ke kade sihlukumeza kule clinic. Ngihlukumezekile ke mina lapha mina ngidla amaphilisi awe-TB nawe engculaza. Ngiyawadla cha lokho ngeke ngufike. Kodwa lapha ngisenokuthi mangifika lapha benganginiki. Bethi ifayela lama ngazi amafayela kanjani awekho adukile. Ngiphinde ngibuye ngeenyawo ngize kumanje nje anginawo amaphilisi. Iviki nje seliphelile ngingawadli. Iviki nje liphelile ngingawadli. Ngabasho ngalimekhani ngambabuza bathi nifayela yamabaliboni futhi mina ngazi ubani udokotela wathi kumele ngiwayeke awe-TB. Ngindlela ngathi mina kulungile phela makuthiwa ngiwalethe la ngoba bekunemonto ebifika isilethele yona lana wengculaza nayo ukuthi asathe nginyaka lezi insuku. Nokuthi mawufike lapha nama ukuthi ngiyafika mhlawumbe ngiphethwe noma yisisu ngeke befikele bafike bekunikeza amaphilisi einhlungu azokwenzana amaphilisi einhlungu. Mawusabathe uyabuza kuthiwa uyaphapha nina abantu basenumber 2 niyedelela vele yikho sinilayo. Uthi uhleli khona kulo line ushukisha ibhenji kusukela ekseni kuze kushona ilanga. Bekusuke lapha bekuthatha amaqoqa amafayili ngemumva kodwa yona kade ufikile. Bethe nahamba nabuyela lemva sazokwenzela lakhe elinye ifayili ngoba la kasilitholi. Kathathu nje eduka khona lapha kuyo le clinic. Mina ngiphatheka kabuhlungu impela ngaye ngicela sengithi sengiyadikila sengiyawayeka ngoba bathe sengisho njalo vele namanje ukuthi ngathi ngiyayeka. Ushintsho mangazi masingathola abantu abazosilungisela bona noma mhlawumbe ke beshintshele noma zona lesi staff esikhona ngoba bona hayi cha abazizwile thina. Manje besacela bafethu ukuthi nisisize noma singasakheleka ngiclinic eseduze ke lapha futhi ezosiza khona la emakhaya nazi ikhona indawo la. Ngiyacela bafethu.
Inkinga engaqala ukubhekana nayo ehlobane bangithatha igazi bezo-check ukuthi igciwane lingakanani egazini. Mangibuya ngizo-check ama-results kwathiwa alahlekile. Kune-date lapho bakutshena khona ukuthi ufuna uzo-check ama-results akho ukuze bezokhona ukufaka efayileni. Mangibuya bathi ama-results alahlekile angiphinde ngiqale phansi ngithatha igazi. Ngiyathatha igazi kwangabi nankinga yazi manje sebeyangithatha kahle amagazi. Uyabo njengami ngoba ngaba nenkinga sengikwesinye isikhathi ngiwafica efayileni. Yebo ngiwafica esefayileni mangithi ngiya-check vele sesefayileni yami manje. bangichazela.
Kulonyaka January uqala nje emva kwamaholide ngasa umntwana kamzala eklinikhi egula mangifika khona bamthatha ama-test e-HIV bathotha awekho u-negative base unesi engangiqondane naye wakhipha amalokhunjana amaphilisi e-TB wathi ngoba engena-HIV obvious ukuthi-ke i-TB angimqalise wona. Ngabuza ukuthi uma sewaqala sekubuya ama-result ngoba wathatha ama-samples ngaleso sikhathi wathi asibobuya sizowalanda wasinika i-date esizowalanda ngayo. Ngathi mina mayebuya lama-result ethu negative sengimphuzisile wangitshela ukuthi ngoba ngazi kakhulu bengimsaphi pho la eklinikhi ngoba ngathi ngusiyazi bengamelaphi ingane yena sengizomfundisa umsebenzi wakhe. Nami-ke ngibona isimo somntwana ngawathatha ngaxolisa ngamphuzisa umntwana amaphilisi. Masibuyela silanda ama-result akanalutho umntwana usephuzile amaphilisi kodwa. Abange besanginika ncazelo-ke mase ngibuyela emuva ukuthi ingani phela nakhu ngawaphuza. Bathi angimyekise immediately. Kwafuneka ukuthi awayeke. Futhi ukugula kwakhe kwakungamile kwakungathi into eqhubekayo nje. Ngazi ukuthi akasizakali ngalutho nokuthi asizakali ngathi kuya ngokuba wesi lokho kwakumphethe. Akatholanga kusiza uma wakhe wakhipha ephaketheni lakhe wamusa kwi-specialist. Wathi cha angimkhiphe eklinikhi ngoba nje namanje ngisho khona ogulayo indaba yaseklinikhi asisayizwisisi kahle. Kuba nzima impela akekho osebenzayo ngoba umzala urithayile ngoJune. Ebesebenza le emakhishini eMpumalanga warithaya-ke. Sesize sincamela ukuya eklinikhi yasedrobheni ngathi i-service ingcono khona ayifani neyala ehlobane. U-48 rand i-return. Cha asizizwa kahle kakhulu ngoba akusemina ngedwa abaningi nje abangasayi-attendile eklinikhi ngenxa ye-service ayikho kahle ngoba unokuhambela ubala ukuthiwa ayikho nemithi. Bekungakuhle nje kuqala ekukhuthaleni nje kwamanesi akhuthale nje azi ukuthi azokwenzani ngoba uyaphela 2 hours ninganakwe muntu ngakho ngisho nibhalisayo nihleli nje behla benyuka ungasithi kwenziwani. Uzobona sebeye lantshini futhi esinye isikhathi leso. Mawuhamba nje nengane uba senkingeni izikhala ingane ungabisazi uhambe ekuseni kodwa ngike ngayojova. Mangifika cishe bese ngibuyela inyanga yesithathu. Ilokhu njani i-family planning ingekho. Ngaze ngafosteleka ukuthi ngithi abangifake iluphu. Ngafaka iluphu ngithi nami ngizama ukuthi ngiyiphephise. Lutho ngayikhipha yangophisa 2 months wonke ngopha nje. Ngaze ngayoyikhipha ngathi ngicela bangikhiphe yona ingiphathi kahle. Sengibuyele kuye idepo leka 3 months. Ngohlaba khona futhi kuyenzeka ungawufici kuthiwa awukho. Bese kufuneka ukuthi ngiye ekhemist ngiyohlaba khona ngo-70 rand. Bakutshela nje ukuthi nababasi ukuthi uzoba khona nini. Mhlawumbe uthi uyobheka futhi kuthiwa awukakabe bikho kusenjalo nje nathi sasenkingeni asazi ukuthi ingaxazululeka nini.
Ngahamba ngaye eklinikhi. Ngafika eklinikhi kwi-date yami. Ngahamba eklinikhi ehlobane ngafika khona. Ngafika ngathatha amaphilisi ami ngafica omunye unesi engakajwayeli ukumthola. Ovama ukunginikeza. Kusho ukuthi-ke ngewanginikeza-ke amaphilisi ami wakhipha amaphilisi. Ngawabona ukuthi la maphilisi lana ungathi akusiwo engiwadlayo. Wathi yena mangimtshena lokhu ukuthi hawu angathi akusiwo nesi lana amaphilisi lana engiwadlayo na. wangitshela ukuthi vele sijwayele ukusho njalo ngoba noma sekushintsha iphepha sithi akusiwo yiwo lamaphilisi lana. Ngathi awunesi kodwa awangijabulisi ukuthi yiwo engiwadlayo. Wathi thatha amaphilisi. Ngithi ngiyambheka athi ke na yini ngathi wena usuyazi kakhulu. Ngithi ke cha nesi ngibona ubuso bakho ngathi awukho right. Yikho ngibheka ngathi lamaphilisi nawo akusiwo awami. Unginike wrong. Hayi ngaqhubeka athi angiwathathe ngawathatha ngahamba nawo ngoba vele angisenawo. Ngahuda kakhulu. Ngihude kakhulu ayi ngiqale ngitshene ukuthi inyongo. Ngithi ngenzile lokho ayi ngithi mase ngithi manje ngiyalifaka nje iphilisi. Ngihuda into engayazi. Ngithi ngiyalifaka iphilisi lelo ngesikhathi salo. Kude into engayazi. Ngayithatha ingqondo ngathi ayi ngunandi iphilisi engenza lento. Yini mangilifaka nje kwenze njalo. Ngafika kubo ngahamba nawo. Ngiyagula ngafika umfana nje othe ukuthi ngathi unomzimbana ngathi ngane yami ngiyagula. Ngilethe nanka amaphilisi. Akukafika isikhathi kodwa ngilethe nanka amaphilisi. Ngiyagula kanje. Wathi mama akhipha mama ngwabona. Ngawakhipha. Wawabona. Wathi umfana, "Hawu mama, uze bakunikeze amaphilisi anjena kungani?" Ngathi phela ngazi mina ngane yami. Ngoba ngithena mangithi ngathi akusiwo. Wathi yiwo. Manje ngane mina sebusuka angisalali. Ebusuku. Kodwa wanela kungisiza kulowo mzuzu lowo. Ngabuya ngaqhubeka nalana bangisiza ngabathatha lana. Azange ngiphindele nawe ekhaya banginikeza ayiwo ke ngaqhubeka nalana ayiwo. Hayi ngaphila ke ngane. Ngiyaqhubeka ngane ukuthi izinto zishintsha kanengi yabona. Kusasa yileli ungazi bangakutshela ukuthi ushintsha ngoba kunjani manje. Ushintsha kuleli ubuze nawe bathanda awazini. Ubuze ukuthi leli ke ngilidla kanjani ngoba usubona sekungelinye ibhodlela ngane yami. Kanti awuwazi namaphilisi ukuthi uwadla kanjani. Cha ngane yami ngishintshisa ngibuziswa ukuthi leli bhodlela angilijwayele. Mawubuza nje umbuzo ayikho into eright. Yikho ke ngane yami ngasaba ngesinye isikhathi kathatha isikhathi ngesaba kodwa ngiqhubeka nala kodwa kufika isikhathi sokuya eclinic ngithi Nkosi yami sebeza ngithatha kabi ke kanti phela bengigula kuze ngiyoveza lokho.
Mina nguma Mthokozani Khumalo bese kuba ngelanga kuye mina ngaqala ngathatha iPep smear kunemobile ekifike sayenza ama-Pep smear mase sifike sithola ama results angawathola and then baqhubeka ngahamba ngayipholi and then mangifika epholi khona ngenza ikhathi you have to wait ama hours akhona ekhathi ngisho ngafika ngo6 and amapharathe ebheke kepholi awadlali ekseni niyalinda ngaphandle ama security sosendlini zawo ngaphakathi esangweni thina sisemnyango so uthi usungenile khona ke ngaphakathi ulindile amakhadi esinye isikhathi futhi emakhadini 2 to 3 hours and then musungenile futhi you follow iqueue lebevele bephambi kwakho ulindele 3 hours mase fanele ngiyobona no doctor ukuthi nakho ngenze ipersonal tomato zathi angiwatholanga now still ngiyaqhubeka ngiyableed kodwa futhi angikwazi ukuthi ngithole usizo ngoba nefanele njalo ngibuye kabili mina ukuze ngithole usizo udoctor ngizumthola namhlanje ngoba ngabo past 2 abasekho ngabo past 2 to 4 abasekho ngizoze ngilinde ngizongena labangena ngo6 lapho fanele ngiphuthume futhi abantwana endlini yayibona lonto so nje uma sefanele ukuthole ngisho i-medication ubuye kabili ngalo suku losibili kuzombona ku doctor utho ufanele kuyehambe ke manje uye-dispensary olanda i-medication yakho iyashota yabona lonto kune stock out nje yabo bathi phele emuva akekho yini umuntu since ke sibuye sibeka tag akekho yini umuntu okulokhuzana efanele a-order na iphele emuva kuma dispensary kuma depot noma ithini into kushuthi wazi kakhulu wena usuzobuza kanjalo so umuzofika nolwazi wena uzofika nalo bayakuphoxa istaff sakho siyakuphoxa ngoba wazi kakhulu kuzoma la eceleni yabo ungakwazi ukuthi usizakale enye into engihambe because mina awukho ulokhuzana chronic enguthathayo awukho, but ngike ngisize ogogo abaseduze nathi nabantu abaku chronic wama-ARVs nogogo abakushukela nani ukuthi bathole i-treatment yabo. Mhlawumbe mathothi akayikho umzukulu ozokwazi ukumsiza, then ngiyalithatha ikhadi namanye ama-comrade esinawo ukuthi sikwazi ukuthi siyobalandela ama-treatment. Kodwa uthola imibuzo eminingi ukuthi uphi umnikazi waleli khadi, kufanele siqale phansi sizi-introduce ukuthi siwobani nobani, bathi bacela i-proof, yabo, uphindele emuva ungayitholanga i-treatment yalo muntu agcine ese-default. Mhlawumbe ngithi nje la mina esadini lami mhlawumbe bawu-4 ogogo, khona bawu-4 ogogo bese kuba abawu-2 abama-ARVs. I think 2 months, because kwaphoqa ukuthi laba abawogogo kufanele sibaqashele imoto, ngoba phela kufanele babone bona ukuthi ngempela labantu abaze la bezolandela i-treatment kufanele benibone ukuthi lo muntu akanayo imali yokugibela ezeditshola uma kuyiwe ePoli, yabo. Kufanele kulindwe aze ahole bese sifuna imoto sihambe naye sithi nangu kube yima bekwazi-ke manje usuzokwazi-ke manje ukuthi uqhubeke usuzobathathela. Kumele sisupportane, ngeke sigibele sonke siye ePoli asinayo sonke imali. Uma oyedwa enayo imali kufanele aphathe amakhadi asibuyele nayo, uyayibona lona, sa-promote lo. So kufanele uma uye eklinikhi uphathe kahle because usuke uzofuna i-service umuntu athi umsebenzi ungene ngenhliziyo kuwona, yabo. Ungazi umuntu abuyele emuva engawatholanga amaphilisi akhe efanele awathathe. And 2, kunenye futhi i-patient erifeyiwe futhi kumina othola ukuthi iqala ukuthatha ama-ARVs ngo-2012. So now through lo mlutho kade ukhona, angithi asena clicks eBridge City yonke ayikho, uyayibona besino clicks khona belokhuza khona bethatha khona. So amanesi umuntu umefika nje futhi defaultile bamthatha noma kanjani, bayamthethisa bengabuzanga ukuthi yini eholele ekuthenini uze udefault, uyayibona, because sinama different challenges esinawo kuma families ethu alidela ekuthenini uze udefault i-treatment yakho, uyayibona ukuthi ngeke uvele udefault ngaphandle kwezizathu usuyithathe for all these years from 2012 up until 2019. Ikhona inkinga lo muntu abebhekene nayo eklinikhi, kuthiwani ke hamba ngoba date yakho asikwazi ukukusiza, yabo. Esikhuleni sokuthi bahlale phansi naye bathola inkinga ukuthi bikuphi ukuze akwazi ukuthi lokhu
Kulonyaka January uqala nje emva kwamaholide ngasa umntwana kamzala eklinikhi egula. Mangifika khona bamthatha ama-test e-HIV bathotha awekho, u-negative. Base unesi engangiqondane naye wakhipha amalokhunjana amaphilisi e-TB, wathi ngoba engena-HIV obvious ukuthi-ke i-TB angimqalise wona. Ngabuza ukuthi uma sewaqala sekubuya ama-result, ngoba wathatha ama-samples ngaleso sikhathi, wathi asibobuya sizowalanda, wasinika i-date esizowalanda ngayo. Ngathi mina uma ebuya lama-result ethu negative sengimphuzisile, wangitshela ukuthi ngoba ngazi kakhulu bengimsaphi pho la eklinikhi, ngoba ngathi ngusiyazi bengamelaphi ingane yena sengizomfundisa umsebenzi wakhe. Nami-ke ngibona isimo somntwana ngawathatha-ke ngaxolisa ngamphuzisa umntwana amaphilisi. Masibuyela silanda ama-result akanalutho umntwana, usephuzile amaphilisi kodwa. Abange besanginika ncazelo-ke mase ngibuyela emuva ukuthi ingani phela nakhu ngawaphuza. Bathi angimyekise immediately, kwafuneka ukuthi awayeke futhi ukugula kwakhe kwakungamile, kwakungathi into eqhubekayo nje, ngazi ukuthi akasizakali ngalutho kunokuthi asizakali, ngathi kuya ngokuba wesi lokho kwakumphethe. Akatholanga kusiza uma wakhe wakhipha ephaketheni lakhe wamusa kwi-specialist, wathi cha angimkhiphe eklinikhi ngoba nje namanje ngisho khona ogulayo indaba yaseklinikhi asisayizwisisi kahle. Kuba nzima impela, akekho osebenzayo ngoba umzala urithayile ngoJune, ebesebenza le emakhishini eMpumalanga warithaya-ke. Sesize sincamela ukuya eklinikhi yasedrobheni, ngathi isevisi ingcono khona ayifani neyala ehlobane. U-48 i-return. Cha, asizizwa kahle, asizizwa kahle kakhulu ngoba akusemina ngedwa abaningi nje abangase-attendile eklinikhi ngenxa yesevisi ayikho kahle ngoba unokuhambela ubala ukuthiwa ayikho nemithi. Bekungakuhle nje kuqala ekukhuthaleni nje kwamanesi, akhuthale nje azi ukuthi azokwenzani ngoba uyaphela u-2 hours ninganakwe muntu, ngakho ngisho nibhalisayo nihleli nje behla benyuka kungasithi kwenziwani. Uzobona sebeye elantshini futhi esinye isikhathi leso. Uma uhamba nje nengane uba senkingeni izikhala ingane ungabisazi uhambe ekuseni kodwa ngike ngayojova. Uma ngifika cishe bese ngibuyela inyanga yesithathu. Ilokhu njani i-family planning ingekho. Ngaze ngafosteleka ukuthi ngithi abangifake iluphu. Ngakufaka iluphu ngithi nami ngizama ukuthi ngiyiphephise. Lutho ngayikhipha yangophisa 2 months wonke ngopha nje. Ngaze ngayoyikhipha ngathi ngicela bangikhiphe yona ingiphathi kahle. Sengibuyele kuye idepo leka 3 months. Ngohlaba khona futhi kuyenzeka ungawufici kuthiwa awukho. Bese kufuneka ukuthi ngiye ekhemesti ngiyohlaba khona ngo-R70. Bakutshela nje ukuthi nababasi ukuthi uzoba khona nini. Mhlawumbe uthi uyobheka futhi kuthiwa awukakabe bikho kusenjalo nje nathi sisasenkingeni asazi ukuthi ingaxazululeka nini.
Sanibonani, igama lami ngoNcamisile Ngwakandawonde, iklinikhi engiyisebenzisayo i-Azalia eMaritzburg.
Ncamisile Ndawonde, I use Mpilo Enhle Caluza Clinic. Azalia Clinic.
Inkinga mina engibhekane nayo i-Azalia, amaphilisi mina ngiwalanda pick up point. Kwaba usuku lokuthi ngiyovuselela ngahamba ngaya khona. Ngithe ngafika kwathiwa ifayili lahlekile.
I collect my medication at pickup point at Azalia Clinic. When I went there for the next time, when I get there, my file was lost.
Mangifika khona bethi befuna bengimisile bethi asalifuna ifayili. Bayifuna bengatholi.
They tried to check my file. I've been waiting at the clinic and my file was not found.
Ekugcineni bese bethi bazongenzela ifayili elisha.
At last, they decided to do the new file.
Bengenzela ifayili ngihambe ngiye ku sister. Mangifika ku sister ngaya kuyena. Afika to sister. Hayi ubungasawadla amaphilisi.
I went to the sister after I got my new file, and then when I go for sister's consultation, the sister told me that I defaulted long time on medication.
Ngimtshele sister amaphilisi bengiwadla bese ethi into esizoyenza sizokuthatha amagazi siqalise phansi.
And I told the sister that I've been taking medication for a while, and then the sister said that because of that, we'll start again for your medication. And then they decided to take blood for me for my viral load.
Bawathatha kamagazi.
Then they took my blood.
Base bethi ke angihambe ngiye kumchunu, umchunu ngikhulume naye anginike idate ukuthi ngize nini.
I went to Mchunu for the next appointment date.
Wathi umchunu akuyena ozongibona, umuntu ozongibona udokotela, angiye angihambe ngobhokhela udokotela.
And Mchunu sent me back to the doctor and told me that I'm not the one who will consult with you. The doctor is the one that will contact with you.
Ngahamba kwathi ngiyobhekela udokotela kwathiwa kugcwele udokotela futhi akekho kulezi zinsuku.
I went to the doctor back and then they told me the doctor is full, and then the doctor was not there, and the schedule of the doctor was not at Azalia Clinic.
Ngabuyela kathathu e-Azalea ngiqiqa le ndaba nje ngishona ngapha nangapha nje kungalungi kwazothi ngosuku lesi-4 ngase ngibatshela ukuthi cha bafethu ngoba ngisizakali sengilinde kakhulu emsebenzini sengilove ka4 inyanga eyodwa umlungu usecabanga nokungixosha ngicabanga ukuthi bafethu nizobona ukuthi nenze njani babuza ukuthi amaphilisi ngithi amaphilisi asekhona engiwaphuzayo kodwa mangabe sephelile ngizobuya ngizowalanda amaphilisi ngahamba ngabuyela emuva sase safonela usisi-ke lo ekebe pick up point okuyena okwesilethele amaphilisi ngamchazela wayesethi okay okuthe emveni kwalokho ngabona sebengifonela bona futhi okusho ukuthi asibuyele imphumela bathi amaphilisi bazowaletha endlini bawaletha bona-ke endlini.
Through the back and forth process, I nearly lost my job because I went to the hospital several times without any help and any assistance. Then from then, they tried to locate my medication. Then I went back to Pickup Point, and then I get my medication on the Pickup Point.
Bawaletha bona endlini bawadeliver endlini base besuka abaxolisanga ngayo yonke lento abayenzile ngoba sebewatholile ama-results bathola ukuthi amaphilisi bengiwadla azange besaxolisa ukuthi iphutha libe kubona kwaba ngoba sebe-right bona nami sengiyi-right.
After they got my result, there was no apology that I was never defaulted on treatment. There was everything kept on being good without any apology. Only thing that I want is only apology so that I will continue my medication.
Ngiyabonga.
Thank you.
Ngiyabingelela.
Greetings, everyone.
Igama lami uLondiwe wakamemela ngiqhamuka eMaritzburg.
I'm Londiwe Memela from Pietermaritzburg.
Iklinikhi engilisebenzisayo ngisebenzisa i-Street Boom. I-Street Boom kuno into eyenzakala khona uthatha i-treatment uma udla i-treatment ye-HIV mawugula uphethwe umkhuhlane kuthiwa ungenzi ikhadi laseklinikhi kumele ugule ngefile yakho.
At Street Boom Clinic, we receive our treatment there. But when you are sick, you are told that you should make a different file for that.
Mawuthatha ifile yakho ke uhambe uyogula uphethwe iflu khona la ngangiphethe khona iflu enkulu. Manje mase ngiqhubeka ngihamba ngiyolanda treatment yami sengiqedile ukugula. Manje angazi noma manje ungafundi ifile noma benzani. Baleke benginike i-treatment engile ngayithola yokugula amaphilisi e-fever umuthi wesisu i-treatment eningi then eyami i-treatment efanele e-asthma neya-HIV e-asthma ayisapheleli sekukhona iphampa eyodwa engayitholi.
When I returned to the clinic after I was healed from flu, they kept on giving me the same treatment. I'd never received my asthma treatment and my ARV treatment, but I received the flu treatment still.
I-treatment engiyidlayo nomntanami uyayidla i-treatment. Sathola ukuthi i-social worker laselithi kufanele ngabe umntwana since edla i-treatment emncane ena 3 years. Kwakufanele ukuthi abambhalele ukuthi athole isibonelelo sahulumeni.
Me and my child are on the same treatment, which is ART. So the social worker referred us so that the child can get social services grant.
Uma ngabe sikuveza lokho eklinikhi ukhuluma nabo bachazela ukuthi i-social worker lishilo bathi ayenzeke into efana naleyo.
When I explain to the clinic staff that we were referred by a social worker, they tell me that there's nothing of that sort.
Uma ngabe ubachazela inkinga yokuthi umntwana kuyenzeka ukuthi angeze uzolanda amaphilisi njengoba eseze wakhula wamdala manje usefunda ugrade 11. Kuyenzeka angeze uzolanda amaphilisi ngoba ekhaya kusebenza umuntu nama ngisebenzi.
When you explain that my child sometimes will not be able to come to the clinic because no one at home is working and my child is now in grade 11.
Uhlaleleni ungahambi uyofuna umsebenzi. Wawuzalelani? Iyona mpendulo abazokutshela yona leyo.
They will ask, why are you seated and not looking for work? Why did you bear children that you cannot afford?
Yonke lento akayishoyo uyisho phambi kwengane yakho. Kusho ukuthi manje wena uhlukumezeka phambi komntana wakho yonke lento akayishoyo.
All of this they say in the presence of my son, which is very humiliating.
Ngenhlanhla ke umntwana esikoleni mayihamba iclass adlulela kuyona ngihambe ngiyochazela uthisha azongena kuyena ukuthi unenkinga ukuthatha treatment kanje kanje.
So luckily, each and every grade, I need to go and explain to my son's class teacher what our problem is.
Uthisha ke uyele ambuze umntwana ukuthi inini date yakhe yokuthi aye ekliniki amtshele khona ezomsiza amnikezele imali yokugibela ukuthi ahambe ayothatha amaphilisi ekliniki.
And the class teacher will be of help and inquire about the next appointment date so that they can be able to assist with transport fare to the clinic.
Njengoba sekwazi ukuhamba yedwa ke aye ekliniki kuhlukanisiwe manje ekliniki ukliniki ngala uwela umgwaqo uphethe ifile uwela umgwaqo nanka amatekisi nazi imoto manje umntwana ngicabanga ukuthi uyahlukumezeka because uyabuza ukuthi manje mama sesileke seqa umgwaqo sishonisa le asazi noma sime line no right ni basazozana ukuzosilanda siwelisa umgwaqo futhi siyoshona le shuthi kuhlukumezeka lokho yindaba ngingasabi into eyodwa njengoba kade kuyinto eyodwa.
So now since he's old enough to go by himself, he's disturbed by the fact that he has to go to different lines, especially because he needs to cross a busy street to get across to the other side. And he inquires as to why they need to be shunted to different lines because previously it was easier.
Wayibhalela ukuthi fanele sithola amaphalishi abasamniki bawavala kodwa bona amaphalishi bayawathatha bayise emakwabo.
We were registered to get porridge packs and we never receive them now, but they take them to their homes.
Inkinga yokuthi honest ukuthi omasifikile ekliniki shuthi thina baye indlela engibuka ngayo baye babuka ngazo ukuthi shuthi thina emakhanda ethu mhlambe asiphilile.
The problem that I see is that when you go to the clinic, they take you as if you are not well upstairs.
Ngoba unesi akakwazi ukukhuluma nepatient mabili bathatha onesi abakwazi ukukhuluma nepatient unesi ukutshela into akutshela yona.
Most nurses do not know how to address patients properly. It's just a few of them who can talk to us.
Ukuthi kuhlala kanjani akanandaba wena ngoba uxakekile kuze ekliniki fanele umthobelele. Ngiyabonga ngicela ukuthi bashintshe indlela yokuyiphatha.
They don't care how that sits with you. We would appreciate it if they can change their attitude towards us. Thank you.
Sanibonani. Igama lami nguThabile Mhlongo.
I'm Thabile Mhlongo
Oqhamuka eNtseleni, osebenzisa eNtseleni clinic.
from Teleni area using Teleni Clinic.
Njoba ngilapha ke ngize nesikhalo
As I'm here with my problem.
sokuthi iNtseleni clinic ayisiphathe kahle as ama patient.
The Teleni Clinic is not in favor with us as patients. They don't treat us well.
Monday bengise clinic
On Monday, I went to Teleni Clinic
ngihambise umntana
with my children.
age of I think 9 years, I'm not sure. Got 9 years.
My 9-year-old child.
Okay, mengifike ekliniki kwathiwa umntana fanele athathe amagazi.
They told me that my child should take blood.
So mayithatha amagazi okay ngavuma ngophela kwakusho udokotela.
I agree as the doctor's request.
Uma ngithi ngiyalandela ke efayilini umntana ngithola ukuthi uthatha amagazi ngoJanuary.
When I follow up on, through the file, I saw that the child also took blood around January.
Mese ngiyabuza komunye usister owayekhona endlini le egumbini lethu.
I asked the sister who was consulting with us,
athi kushuthi udokotela ube ne-misunderstanding.
so
Akazi
she
sifanele
told us
ukudla-
that the doctor had a misunderstanding.
Mese-ke ngiyabuza ukuthi okay njengoba nimnika amaphilisi ka-3 months lawa ashodayo nithi enze njani ngawo?
I inquire regarding the 3 months supply clinics, and then I asked them, what about the ones that are not in the package?
Wasethi-ke usister wase-pharmacy angibuye anytime ngizowa-collect.
The pharmacist sister told me that I should come back and collect my child medication.
Sicela ukuthi as ama-patient ama-nurse asiphathe kahle as abantu baka-chronic.
Our plea to the department is that we ask for the staff to treat us well as a chronic patients.
Nabantu abase-pharmacy basazi isitori sabo ukuthi yini abayizele e-pharmacy bengasiniki i-medication ephelele.
The pharmacists, they should know their story.
Thank you.
Siyabonga.
Sanibonani. Ngikhuluma noNtandoni wakaMakhoba from Emacekana.
Area?
Iklinik yami Impangeni clinic.
I access services at Mpangeni Clinic.
Mina ngizokhala isikhala uma ucele i-transfer uya kwenye indawo. Bafike bangafuni ukunika i-transfer. Banginike ngesikhathi sawo uhambe uye kule clinic ofuna ukuya kuyo. Mina ngifuna ukuya eGoli ne-transfer. Banginika mase ngibuye eGoli benqabe ethi eGoli angibuyele eclinic yami. Mase ngifika ngapha sengibuye eGoli. Bangitshela ukuthi abazonginika amaphilisi angiyolanda transfer eGoli.
We experienced problems with transfer letters. I was moving to Johannesburg and requested a transfer letter, which they gave me. But when I came back from Joburg, they refused to assist me without a transfer letter from Joburg.
Bathi namaphilisi engiwathole ma angiyilande eGoli abaseGoli bathi abazonginika i-transfer ngoba ngibuyele eclinic yami.
They said I should go, they won't give me treatment, I should fetch it from Joburg. And the staff from Joburg said they were not going to give me treatment still.
Mangifika la eclinic eMpangeni benqaba ukunginika amaphilisi kwaze kwaba iviki lonke ngingawadli.
I spent the entire week without taking my treatment.
Banginika ngaze ngafuna unesi omunye wangisiza wathi yini inkinga yakho sekuphela iviki lonke. Wayekhona benginika amaphilisi sengingawadlanga iviki lonke sebenginika ngoba sengisho sengifuna umphathi wakhona ukuthi yini ngingawathola amaphilisi ngoba iGoli abafuna unginika i-transfer. Ngapha mangibuye eclinic yami room 5 bathi angibuyele room 6 room 6 bathi angibuyele room 5 kwaze kwashona ilanga nje bengisale.
I was assisted by a nurse at the facility when I had escalated the matter to the facility manager, who then made sure that I get my treatment after being taken from pillar to post.
Ngawathola sebenginika khona sengidelay bangikhipha futhi eclinic banginika ikhadi lokuthi angiwalande ekhemesi ngoba mina ngiyahlupha eclinic.
I finally got my treatment and I was decanted from the clinic to an external pickup point.
Ilokho kwangiphatha kabi kule clinic yaseMpangeni.
That was my challenge with Mpangeni Clinic.
Mawulahla ikhadi,
when you have lost your card,
abafuna ukunika ikhadi futhi lapha eclinic. Bakutshela ukuthi uma ucinga uzothole ukuze banginika amaphilisi. Ngaloso sikhathi amaphilisi ungenawo.
They refuse to provide a replacement card. They tell you to look for it till you find it. At that time, you sit without taking your treatment.
Into engicelayo eclinic yaseMpangeni ukuthi bashintshe ukuthi masicela usizo basinike lona. Hayi ukuthi umuntu akhethe ukuthi ubani.
We appeal to the staff at Mpangeni Clinic to assist us when we go there to look for assistance, and they should not be favorable or have preferential treatment.
Ngiyabonga.
Thank you.
Khona ushudile. Ngabatshela eclinic ngathi amaphilisi angenza umbandami bangafuna banginike ishubhu ngathi mina upheli bathi kusho ukuthi amaphilisi angiwadli kahle ngathi
I was having ringworms as a side effect to the treatment that I was taking. I conveyed this to the staff at the clinic, and I was told that I was not taking my treatment the correct way.
ngabatshela ngathi amaphilisi ngiwadla kahle la bangishintsha banginika amanye ngastil ngasho ngathi imbandami ayipheli namanje ayipheli.
I explained that I take my treatment the correct way, and they changed me to another treatment regimen, which the problem still persisted.
Abafuna unginika-ke manje umuthi bathi shuthi ngizohlala nginalo mbandame ngoba amaphilisi ayikho umuntu athi amgulise.
I am not getting any treatment for the ringworms, so that means I will stay like that because they maintain that no one else has experienced that.
Ubuhlungu lokho ngoba imbandame kimi ayipheli namanje.
That is very painful.
Ukuthi ngenze kanjani.
That is very painful as I'm still experiencing or I'm still having the ringworms, so I do not know what to do.
Okay, ngiyabonga.
Thank you.
Thank you. So the recommendations are from November 2021, the KZN Department of Health and DSPs should ensure that all healthcare workers provide accurate and easily understandable information on treatment adherence, the importance of undetectable viral load when talking to people living with HIV through consultation, counseling, outreach, and health talks at a clinic. From November 2021, the KZN Department of Health and DSPs should ensure that viral load tests are properly explained to all people living with HIV in a timely manner. In COP22, PEPFAR should fund an expansion of people living with HIV-led treatment literacy efforts across all provinces, including KZN, through training, education, and localized social mobilization campaign. Now we are going for a presentation on index testing, which Ndivua will assist us.
Thank you, Chair. Okay, so when we look at index testing, 100% of facilities that are monitored through the Ritshidze report engaging in index testing. While index testing has the ability to identify individuals who may have been exposed to HIV earlier, if it is implemented in ways that cause harm to individuals, undermine their rights to consent, privacy, safety, and confidentiality, it is problematic and erodes communities' trust of healthcare providers. We are concerned that screening protocols are not always being followed. 90% of clinics say they always screen clients for intimate partner violence. This needs to be at 100%. 52% who do screen for IPV still contact all the partners regardless of reported violence. This is a concern and major violation of people's safety and privacy. Only 39% said that they don't trace the contacts for which there was a reported violence or only contact partners with no history of violence for HIV testing. There is no point to the intimate partner violence screen if contacts are just notified of their exposure in any case. We need to get to 0% of contacts who have a risk of violence being contacted. This is extremely important in the context of South Africa, where prior to COVID-19, the country faced a well-documented epidemic of gender-based violence. On this slide now, we see the PLHIV perspective. So of the 3,122 people living with HIV interviewed, 77% were asked to participate in index testing. We find that 15% did not think they were allowed to say no or refuse to give the names and contacts of their partners, or they did not know. Screening for IPV without adequate intimate partner violence services to respond to a client's positive screen is both dangerous and unethical. We're just now going to move on to our recommendations.
So the recommendations are from, from November 2021, the Department of Health and DSPs must ensure that index testing is always voluntary and that people living with HIV truly understand this. From November 2021, again, the Department of Health in KZN and DSPs must screen to see if the individual partners have ever been violent and record the answer to this question. No contacts who have ever been violent or are at risk of being violent should be ever contacted. From November 2021, adequate IPV services must be available at the facility or index testing should take place. From November 2021, implementing partners, TB Care, Match, Ketimpilo, must monitor all adverse events through a proactive adverse event monitoring system with follow-up to assess violence, disclosure of HIV status, dissolution of the relationship, loss of housing, or loss of financial support. Now we are going for presentation that talks about stock out and shortages of medicines. That will be led by Cynthia.
Thank you, Chair. Stockouts and shortages of medicines, vaccines, contraceptives, and tests cause disruption, confusion, cost, and can cause treatment interruptions. At times, healthcare users can disengage from care, seeing no point in going to the clinic to be sent home empty-handed. In the KZN, only 8% of patients we spoke to reported that they or someone they knew had left the clinic without the medication they needed in the last 3 months. This is far fewer than many other provinces. However, even though it is a lower amount, the challenges should be addressed. This table shows 3 or more patient reports of living without the medicines they need, with as many as 13 to 16 reports in Songonzima Clinic, Osizweni Umlazi Q Clinic, Umlazi K Clinic, and Ukaluza Clinic. The most commonly reported medicine shortages by patients were contraceptives, where we had 210 reports, vaccines with 10 reports, and PrEP with 7 reports. Facilities also reported stockouts. The highest reports were of contraceptives, followed by fewer reports of HIV medicines and vaccine stockouts or shortages. Of the facilities that reported stockouts, 99 clinics gave patients an alternative, but worryingly, 22 gave people a short supply and 7 sent people home empty-handed. We need to ensure that people living with HIV and other public healthcare users are able to get the treatments they need when they go to the clinic. We will move on now to the community, one community story.
Uma ngisebenzisa i-clinic le yaseTsekeni. Ngasoyitsekeni ngazohlala la esikhaweni. Ngasebenzisa le phezulu J1. Papa man. Ase ngafika khona ke kwakuyi-date yami yokuthi ngiyolanda amaphilisi ngoba yangishayela sengila ayigciwane. Ase ngafika lapha ayisengasekho ngisengizocela wona. Mangabe ukunikeza kuthiwa angiphindele eTsekeni ngeso sikhathi futhi ngangenayo imali ukubuyela eTsekeni. Ngahlala ngaze nga-default. Ngaphindela futhi ngaphinde ngathi ngiyocela khona. Nakho senginenkinga yokuthi ngiyopha. Ngahamba ngakhona. Ngithi ngiyocela khona kwathiwa kumele ngiye la ngilanda khona amaphilisi ngoba nginesifo esikanje kumele ngilapheke la ngoba ifayili lami lili 2 weeks. 2 weeks. Ngizwa ubuhlungu ngoba ngisabe impilo yami. Bathi kumele ngiyenzelele mhlawumbe bekuneze i-transfer ukuthi ngibuye ngize la. Khona bezofayili izobuya eTsekeni ngize ngaya ngabachaza ukuthi ngaya khona ngabachaza amaphilisi wasekwasa ngambe ngiyalanda. ngaphinde ngabuyela ngasho ukuthi imali ayikho futhi ngiyopha kwathiwa bangabekade bazongisiza ngayo kumele ngize ngiye eceleni khona bezongitransferela ngapha bese bekwazi ukungisiza eklinikhi lapha bavele bayakwenza ukuthi wena uzizwe ngathi manje awusiyena umuntu bona bangcono kunawe ngoba ngishuye khona ukuthi uyozama ukuthi ngapheli la uthola khona usizo avele nje bekuthathe nje isinoma kanjani indlela abathanda ukuphendula ngayo bakuphendula ngayo amaphilisi bangishintshela babejwayele ukunginikala angekho ke-blue bese bangishintshela banginikeza amhlophe bona bachaza ukuthi ngoba bengishintshela kulami ukuthi abangiphathi kahle kumele ngibuyele khona ngiyosho bephinde bengishintshele angiqala bese sengase kunesikhashana singasebenzisa ngijova ngawuyeka umjovo awungophilisi ungikhipha into engamanzi ngezansi ngabachazela bathi angishintshe kuye ka-2 months nawo kwafana ngoba ngangijova ka-3 months bathi angizama amaphilisi ngiyasaba akhohlwele.
Yeah, so we are going for recommendations. From December 2021, there must be effective and immediate communication of stock out between the National Department of Health and the KZN Department of Health and to the healthcare workers and patients. By February 2022, the KZN Department of Health should ensure all pharmacists have been trained in SVS and other supply chain systems. By February 2022, the KZN Department of Health should establish an emergency response team and standard operating procedures to manage crisis situation. We call on them to include clinic committees, all people living with HIV sector organization, and the stock out project. By March 2022, the KZN Department of Health should develop a provincial strategy to address stockhouse and shortages of medicine and other medical tools and supply. This plan must address the impact of human resource shortages, poor management, and infrastructure on the ability of facilities to order and store supplies, and increasing the number of pharmacy staff. Now we are going for key populations, which will be led by Nduvuo. Okay. So in terms of key populations accessing healthcare services, one major barrier to HIV prevention and treatment services for key population is being discriminated against at the facility. Primary healthcare facilities are the entry point for most KPs to access HIV, TB, and other health services. Ritshidze interviews with key populations highlight the pain, discrimination, and even trauma that many key populations face when trying to access HIV, TB, and other healthcare services. And it is very clear why some KPs do not access services or disengage from care altogether. It is critical that KPs can access friendly services that meet their specific needs in order for us to reach the 95-95-95 targets. So on the screen, we're just seeing some quotes that we have collected through our qualitative data collection with key population and some of the experiences when they go in to access services in facilities. It is also critical that KPs can access specific services to meet their specific needs. When we asked facility managers if they provide KP-specific services, in some places they say they do. However, when we follow up with questions around what these specific services are, it reveals the services are not really on offer. So out of 135 facilities, only 37 said they provided services for trans people, but really this was fewer. Only 2 facilities offer hormone therapy, and none offered a full package of services, including hormone therapy, trans-friendly SRHR services, outreach services, for example. Also, out of 135 facilities, 60 said they provided services for sex workers. However, in reality, out of those sites that say they offer sex worker services,
only 34 sites offer HIV care and treatment for sex workers, and only 26 offer sex worker-friendly cervical cancer screening. Also, out of 135 facilities, 48 said they provided services for men who have sex with men. But in reality, only 10 sites offer MSM outreach services, and only 20 sites offer lubricant to men who have sex with men. We know that key populations are using public clinics. We need to ensure that they are able to access friendly services specific to their needs at the general clinic. We're now going to move on to some of the recorded community stories.
I'm a recovering drug addict. Ngisuka eMpangeni ngifike la eThekwini ngenxa yokuthi bese benefamily yami nginokusebenzisa ama-drugs. Ngafika lana ngathola usizo eBellhaven Harm Reduction Center, elapho engaqala khona ukuthi impilo yami ibe sesimeni. Kodwa khona abanye abasabhema abanga-access lama-services akhishwa eBellhaven ngoba iyona sense engiyaziyo nje mina la around KZN enikeza abantu usizo lokuyeka ama-drugs. So bengathi sengazi ukuthi uhulumeni mhlambe engakwazi ukuthi esifakele imethadone ema-clinics, ngancipha nabantu ababhema ama-drug kakhulu ngoba kunzima ukuphuma ema-drugs, ngakwazi ukuvela udecide in a day ukuthi suyayeka nje. Nganokuthini enye into abantu abadla ama-drugs awubaboni beya endaweni ama-clinics ukuthola usizo. Abanye abantu batshela ukuthi mhlambe ingoba bengathanda ukuthola usizo nomani, kanti indlela abaphatheka ngayo mebefika ey'ndaweni zakahulumeni, ey'bhedlela bayacwaseka ngokuthi badla ama-drugs. Abanye uthola ukuthi bangcolile, abasatholi usizo ngokuthi bangcolile. Ngakwenzela nje example, ngake ngaya nomngani wami kusanda kuqala i-COVID nje, siye eklinikhi ephethwe yi-flu. So ngasihambeni ngimphezele eklinikhi. Masifike eklinikhi bathi asingangeni, basibuza ngaphandle ukuthi yini inkinga yabo. Safike sachaza ukuthi uphethwe yi-flu kanjani. Bathi asingangeni ngaphakathi, basilindisa ngaphandle kuma-steps. Mhlampe sawuhlala 3 to 4 hours silindile ngaphandle. Ngisho abantu abafika emva kwethu basizakala, thina baze basisiza ngoba sekuzovalwa eklinikhi ngokuthi asingayindawo ngoba ukube kwakwabanye abantu babezodikila behambe. So yingakho abantu ababhema ama-drugs bengathandi ukuthi be-accesse ama-services ama-clinics, bengayi ema-clinics nani. So kuze kube ngcono la nje eThekwini i-Dennis Hali iyona engcono abantu abadla ama-drugs abaziyo ukuthi mebeya khona ngeke beze bekuthola ukucwaseka noma yini, bethole nezinto abayidingayo njengama-syringe, abantu aba-injectayo, bethole nje usiza noma ngabe ulwana abalidingayo.
I got across the cases that are coming in our office about the sex workers when they're going to assess the services in the clinics, in the government clinics. Sometimes they don't get what they get inside for. First is for the time, the waiting period for the medication and assessing with everything they need is too long. And so many people come there, so they don't get the attention they're supposed to get. The other thing it's happening, when you come to the facility, you're coming to do a prevention. You come there, you're staying the whole day, and after that, when you're going to the nurse tell you, if you're looking for depot, it's not available. If you're coming to do a termination of pregnancy, they say you must fill the form and come next week. Next week when you come, the nurse is supposed to do that termination of pregnancy is not around, of which if you need to do the termination of pregnancy, you have to be not more than of 12 weeks. the time is going and this child is growing, of which is push the women to going in the backside of the street to do abortion. So these are the challenges I'm facing when I'm doing my work. But I'm glad we got people like Ritshidze because they're helping a lot with the sex workers.
I'm a sex worker from Durban. I was once in Eddington Hospital. I was very sick and I came there on time on the working hours, but the treatment I got, it was very, very like unusual. Firstly, before when I go there, they already told me that this one is a default because they know that I'm a chronic person. Secondly, after that, I'm patient. They involve a security to come by force and take me out because it was the time for them to knock out. I don't think that someone who is sick must be sent home to come back tomorrow while you got on time. The gates was not closed yet and it was not like 4 o'clock. Maybe I came even 10 o'clock because they delaying. The security so started to fight me, but I sit down and say, "You can lift me up and take me away." So that's when it started to hit me. Yeah, repeatedly. Instructed by a nurse to do whatever I want to do so that he can remove me out of the site because I'm just a defaulter. But I don't think that I would ever visit Eddington if it's not emergency. The beginning of, it was close to lockdown. It was those few days before lockdown. So currently everyone was up and down, and then even the business was no longer running. It was a bit difficult for me to cover where I'm staying, to eat, and to be able to take my medication. Yeah, that's how I defaulted. Luckily, I had the other organization came and helped me. They not Star Alliance, yes. One of the ladies, she came to me and assisted me. That's how I was saved. Nonetheless, I would have not survived because I was not willing to face the trauma I faced. Even right now, when I say security in the hospital, I just don't understand. I feel like I must move away because they are violent if they are ordered to. And also the staff is not confidential about the status, not even caring what could happen tomorrow to me.
Community KP stories which are in the tent.
Morning, everyone. My name is Toby Simtem, Plus. I'm also an ex-addict. I stay in Pietermaritzburg. I used to go to Imbalente Clinic. Yeah, the staff there usually don't treat us well if they know that you are an addict. So usually they don't give you the right medication. They don't treat you right. They always have securities next to you, just to make sure that you don't take anything from the clinics, but you're coming there to get help. Mostly they disrespect you, yeah, and sometimes I also move away from Maritzburg. I came to Durban because I heard about the medication they take from Durban, which is Methadone. I usually come every week to Durban to take my medication and go back to Maritzburg because I know that's the only place where they treat us well. So yeah, thank you.
Sanibonani. Ngikhulumela ongihlala eTown, ngikhulumela phambi kwe-Eddington nasemasokeni iklinikhi ye-TB. Mina ngihlale kakhulu nabantu abagulayo baze bashona ngokuthi amakhadi bawalahlile. Ngisho lokhona e-Eddington singakwazi ukungena nomuntu through ukuthi ikhadi walahla lovula ifile. Ngingazi-ke noma igama umuntu osuke engasenalo into ayibhalise ukuthi azabone ukuthi uyena.
I stay with a lot of people who lost cards at Addington Clinic, and there was no assistance for them, and some of them, they ended up lost their lives.
Nasemasokeni futhi kwaphinde kwabe kanjalo kodwa bayazazi ukuthi bona bodwa
And also Masogeni,
bahlala nabantu sihamba singathola usizo. Egcineni ke engamthola sengimphelezela ngase ngiyazi uRitshidze ngokuhamba kwami ama meeting. Ngase ngafonela usisi oyedwa kaRitshidze wangena ke. Kodwa nje bonke laba abanye baze bafa ngokuthi nje ikhadi ulahlile akakwazi ukungena. Ngiyabonga. Ne treatment ukuthi abasiphathi kahle. Unesi uzosidlula emgaqweni akazi ukuthi wenzani. Kodwa mase ufika lapha ekliniki athi ngoba uma emgaqweni. Cela bandlo nesi bethi babemsebenzini bengahambi bebuka indaba zabantu.
My plea is that the nurses must focus on their job when they went to work. They must not looking around the streets and see us. So they must focus their own issues and problems. Because when I arrive at the clinic to access the services, they told me that, oh, it's you, the one that you are there by the road, busy with something else, something.
Okay. Sanibonani. Igama lami ngumthokozisi isibongo ngwakamtetwa.
Mthethwa.
Yes, ngihlala eFolweni.
I reside in Efolweni area.
Yes. I'm sorry ngoba khona onesi lana. I like into engizoyikhuluma is so touching kubantu abawonesi.
I apologize because in our presence we have nurses and what I'm about to speak about is specifically negative towards them.
Yes. Onesi babazali bawobaba kuthini.
Nurses are our mothers and fathers.
So if ufike efacility uzo access ama services ase facility usuke uzo access ama services ase facility awuzelanga ukuzojudgewa usister or use osuke khona ngaphakathi.
So when you go to a facility, you needing specific services. You're not going there to be judged by staff in the facility.
Okay, my identity mina ngu MSM. I'm a male having sex with other male.
I
Yes, I'm proud
identify
about that,
as an
bro.
MSM, meaning it's men having sex with other men.
Yes. So there is an incident that's happened. I went to Ntsimbini clinic to nganginenkinga enganginayo. So my anus was like having a intingathi isilondana ngemuva. So I went, okay.
I went to Ntsimbini clinic as I was experiencing a problem. I had a sore in my anus.
Yes. So ngifike usister from the gate ngingena khona. Only to find that the security was busy calling me by name, like calling each other, like a cartoon in the facility. Because ngifika khona bayakhombisana ngami, but I don't know what's happening because nento engigqokile ngigqoka nento eyithena, just wearing a shorts in a skipper. This was nothing entertain abantu.
So when I got to the facility from the security guard, they were making fun of me as I proceeded to the nurses as well. They kept on calling their friends, and I don't know what was so entertaining because I was normally dressed.
Yeah, so when I go in a clinic ngaphakathi, then ngahamba ngadlulisa komunye sister ngafika ngena phakathi. But I ended up sengitreatwa sister abawu4 ngesilonda esisodwa esimeni ngitreatwa abantu abawu-4 because the sister obekufanele ngisize usebize omunye uzomtshengisa ngami.
I ended up being seen by 4 nurses, mainly because each one of them would call another colleague to come and see what was wrong with me.
Into engayibona kuyena, into engayibona kwabanye osister abakhona ema-facility abayenzi i-sexual history yomuntu, abayithathi kahle correctly. Cause into eyabangela lokho ukuthi aze anga-understand ukuthi kwenzakalani ngami, wangibuka, wa-assume, wasefuna ungichitha ngendlela angibuke ngiyiyona. Akatholanga kumina the information efuna benu uyayibuza.
What is lacking is that they don't ask you about your sexual history because they just look at you and judge you. If they had taken the time to ask me, I would have been able to explain to them better and maybe I wouldn't have experienced that problem.
Akulona icala uma ukwazi ukumsiza umuntu, just umtshele, just being like kube transparent ukuthi ngeke ngikwazi ukukusiza. Cause mina ngazibona sengumuntu ongathi uya-attackwa nginabantu abawu-4 abamile and kade ngimile lana ngehlisa ibhluku lihleli la ngezansi kwelokhuze kwezinqe. Ukufika ngenokuqala and nalokuqala ayikho into azongenza yona. Ungathi uzoyithathisa ipeni phezu kwetafula uyamothi akasaphumi lo muntu.
It is not a sin if you cannot assist the person. It's easier to just say you cannot because I was sitting with my pants down while they were calling each other.
And into engagcina ngiphuma angiphindanga ngeke ngisaphinde ngekhona. Into engazikhuluma kubona it's like ngafila as if I have to be activist for abanye abantu abayi-LGBTI community because lento eyenzeke kumina ingenza komunye ongeyakwazi ukuthi voice out ngendlela ngempilo ayiyona.
I vowed not to go back to Nsimbini Clinic because I had to stand up for myself. And now I feel that I need to be an activist to speak up to people identifying like me who cannot speak out for themselves.
The treatment yakhona is not good. The way they welcome yakhona, even the service yakhona, because even sengiqede yonke into sengiphuma ngihamba. Only if I do abantu abasemaromini ipassage lakhona is like ipassage kanje eminyango iphumela kanje iyabukana. Wonke umuntu useyaphuma. It's like kuhamba umuntu angazi noma celebrate or something but bonke bayaphuma bazobukisana ngami. Bazobuka umuntu bazobuka lozozo la inqeni zami. So on a serious note, I feel like there's so much to be done. I think there were Konama program long time ago. I had Konama program ayenziwa amanye organization they do ama sensitization kuma facility.
So the entire treatment was not good because as I was heading out of the facility, people were coming out of corridors to come and I was the center of attention. So previously there were programs to sensitize staff about sexuality.
Yes, and interfuna bayazi abantu abama-healthcare workers.
What health workers should know,
asifuni basithande.
we're not there for them to like us or love us.
Umuntu akenza umsebenzi awuplejela nje awuphume kuyena uhambe ngoba ngeke ngize ngibuye kusasa if wena umsebenzi uwenze kahle.
A person should be able to carry out their job as they had taken a pledge.
It is so painful
Because I will not return if you had done your job properly.
Yes, so ugcina ungasazi nokusho nokunye okukuphethe ngoba manje ugcina usufeel ukuthi no la ngikhona I'm not in the right place. And okwesibili into eyenzakalayo kuma healthcare workers ngiza asifuni basithande. Asifuni basithande sifuna benze umsebenzi wabo abawufungele. Okwesibili ukuthi umuntu vele siyazi as a LGBTI people most of people they fail to accept us. But one thing that we keep on pledging guys, playing you guys to do for us. Just understand us, who we are. Because at the end of the day, there's nothing has to change. Ukuthi ungisizile ngahamba, ngeke uzubonala usize umuntu o-LGBTI person. Ngiyabonga.
Greeting to everyone. My name is Letugu Kanya, known as Letitia Sishi. Can I stand? Is it okay if I stand? Thank you. Thank you. I'll stand next to you. Mina, I'm from Umlazi and one of the trans activists here in KwaZulu-Natal. I am very, very vigilant and I observe a lot of things in my clinics. Reason why I'm saying this, I'm not a person who visits AMA clinics like every now and then, simply because rejection, I fear it when I need something that needs my medical attention. Most things that are needed by trans people are hormone replacement pills and psychosocial supports. If we could just simply get those things, it would be much better. But we have been rejected several times whenever we needed those things. For an example, I have more than 20. Reason why I'm stating this is because I conduct a trans seminar. I'm not speculating any number. I'm saying a number that I have researched. So there are more than 20 transgender people in Durban who have came and said, we are not collecting or receiving the hormone replacement pills simply because we've been told that you are umuntu wesilisa, wena umuntu wesifazane. Reason why they're saying this is because I see a huge gap in our health facilities. And for us to be there in our facility, I will simply share my experience, how I think we should advocate our health practitioners. 2016, I'll go back to how we are started. 2016, I have cut my blood supply on my foreskin. I am a transgendered woman. I was assigned male at birth. Ngizalwe ngumfana. So ukuzalwa kwami ngumfana, there are organs engathandi ukuwasebenzisa simply because I ngobe ngasebenza, but I preferred not to use them. So now here's the problem. I have cut blood supply before skin yam. Angithi siyathaka ukuze kube flat, kube kanje ne, kube khona ama-boobs kanje. So it happened ukuthi ngakhatha blood supply on my foreskin. Then ngahamba ngabona udokotela esibhedlela. Doctor told me ukuthi option ekhona that I need to do now is to cut that foreskin. Something that I've never thought that I would do in my entire life. But into building a candle is just remove it all. Nam give a vagina, you know. But it's not that simple. So I ended up going to a clinic. The closer clinic, it's most dominated by men. There's a huge hall full of boys and men. So I went there with my friend. I had my short dress just to be comfortable when I'm done with this whole process. So I went there, I registered. One of the receptionists, not that she was loud because she saw me, she's just loud because the room is open. So they say Mr. Surname, and they said Mr. Sish. They kept on saying Mr. Sish. So I thought it's maybe another Sishi who's also here. Until I wanted people who came after me being attended. So I went straight to her and asked her, why aren't I being called? You want to send Biza my band? Then she asked me, what is your surname? I said, Sishi. They said, what is it, Biza? But I said, Mr. But hey, I'm like, okay, sure. Can I please continue? What is this one? As far as circumcised, I'm a not even a sissy in circumcised in, if I may ask. What is circumcised about least about a penis? That's always least on a penis. Then I said to her, I'm going to on a penis that needs to be circumcised. Then get it done. So she took it as a joke. I did understand that she's lacking this information on a penis that needs to be circumcised. So I got to a point where I saw someone that I know who said, oh, Ulana, and then that's how I managed to go through the whole process. But the process itself, because the receptionist was shocked that there is a person who says she's a female, but yet she's a vagina, she's a penis. And then I ended up being attended. This attendant thing, it becomes a habit in our health practitioners' space, where you'll find a nurse or a trainee who wants to become a nurse, who would come and attend you. There's only one nurse that attend one patient throughout, but I was attended more than one. What came into my mind, I said to my mind, these nurses, I think it was just a silly idea of myself. They would say, penis but I was happy. So the first nurse came in. There were 3 doctors, I'm just going to summarize this. There were 3 doctors coming in and out in the theater room, one of the doctors said to me, "Ma'am, are you supposed to be here?" And I said, "Yes, but we don't circumcise women." I said, "I have a penis." They said, "Oh," and I said, "I'm a transgendered woman." I said, "Oh, can I please circumcise you?" I said, "No, no problem. I have no problem." Then I was attended. But throughout the course of the nurse who took me through the theater, they put some brown lotion. She went out, then the nurse came and injected me. The only thing that the doctor did that I remember was the cutting and stitching. After it was another nurse who came to take me to the waiting room until I healed the injection that was injected on my private part. Then in this room, there are men who are waiting ukuthi kwehle kudambeke imjovo. And ngihleli phansi and njengoba ngichaza ukuthi ngumuntu mina owaziwayo ukuthi umphathi waze ngani ukuthi ngikhona ngila, only God knows, but I assumed ukuthi staff vele obviously bekhuluma ukuthi sithole into kanje. Then umphathi wakhona weza wafika ngibingelela wathi ngiyakwazi, I've seen you kwama events esiwenzayo especially ka health. Ngathi mina ngiyajabula ukubona. Wathi but uphatheke kanjani? Because ngisane trauma into ebisanda kwenzeka ukuvele ngiveze nje into yami nje kubona umuntu usuke ngena laphayana. Ngathi no ngisa right. Wathi ngicela ukugodukisa mase uqedile lapho yagodukela. But ke I was organizing imoto ngangena emotweni ngagodwa ngayo ekhaya. The healing process, it's something for another day. But omunye umuntu engathanda ukuthi ngimrefere khona eclinic ayowenza MMC, if there's a need ukuthi enze MMC, they fear because bathi asicircumcise intombazane. And then for us ukuze sikwazi ukuthi sithole information, I always plead kubona ukuthi as much as umuntu ezophakamisa ivoice, uzothola usizo ehlisa ivoice yakho nomoya umchazele eceleni ukuthi listen, this is what it is. Naye ngiyacabanga ukuthi ngeke vele asuke nje athi uyintombazane enepipi enjani phambi kwabantu. Then that needs attention kumphathi omkhulu. And when those things happen, asilali because we will parade. We will parade to get a proper services in our clinics aid. And then in terms of receiving ARVs, when people try to collect some ARVs, they will ask you, is it pre-counseling? Pre-counseling, they'll ask you your partners, which barrier methods that are condoms, lubes, and vibrators, you name it. And then when you explain to them, I don't use or I don't engage myself with a opposite sex, I engage myself with the same sex, then they will ask you why. Then you elaborate on it. Then it becomes a barrier when you elaborate more chaza ukuthi kwenzakalani. Bayibuza ukuthi kodwa yini indaba uyixaka njena uyohlala lapha emumva bebe khona umuntu besifazane. Then automatically akusavumi kumina ukuthi ngiqhubeke ngikutshele because the next thing ezokutshela kona that becomes impilo yami, I won't feel comfortable ukuthi ngikuxoxele ngakho. So I think at some point ama-counselor no-nurse, they need that kind of sensitization kubona ukuthi they are trans people. Because ngiyacabanga ukuthi bona bebona emphakathini babona igay babona lesbian sekuphelile. They are trans people, they are intersex people, they are also bisexual people, and we need those services. Ngiyabonga kakhulu.
Thank you. And the recommendations are by February 2022, the KwaZulu-Natal Department of Health and DSPs should ensure that all clinical and non-clinical staff are sensitized on provision of key population-friendly services. By February 2022, the KwaZulu-Natal Department of Health and the DSPs should ensure that a minimum package of services should be provided for each key population group to meet their needs at all clinics and community healthcare centers. By February 2022, the KwaZulu-Natal Department of Health and DSPs should ensure that lubricants and male and female condoms are easily available at all sites. By April 2022, the KwaZulu-Natal Department of Health and DSP should ensure that harm reduction services, including medically assisted treatment and other drug dependence treatment, are made available at health facilities and drop-in centers, where people who use drugs, who need specialized care from a drop-in center, they should be provided with easily referral and adequate resources to uptake those services. Now we are going for a presentation on tuberculosis led by Simpiwe. Sicela niswitcha ama-phone abe ku-silence.
Um, uh, in 2019, 36,000 people living with HIV died of TB in South Africa. TB remains the leading cause of death for people living with HIV in South Africa. One key area we monitor around TB is the level of TB infection control at our clinics. Thank you. We ask 7 questions to assess TB infection control at clinics outlined on the graphic on the left. No facilities were awarded green status for checking all 6 best practice measures on the scorecard. Ritshidze scored 99 clinics yellow status. This translates to 73% of the clinics being monitored, following about half of the best practice measures for infection control. It leaves 34 clinics, or the other 25% of clinics surveyed, failing altogether at meeting these 6 basic best practices to stop the spread of TB. We will move on to the recommendations.
So the recommendations are, by end of January 2022, the KwaZulu-Natal Department of Health should send a circular to all facilities to ensure that all windows are kept open, TB infection control posters are displayed in visible places in the waiting area, patients to be screened for TB symptoms upon arrival integrate with COVID-19 screening. People coughing or with TB symptoms to be seen first to reduce the risk of transmission. People who are coughing to be separated from those who are not while waiting. By the end of May 2022, the KwaZulu-Natal Department of Health should carry out a full audit of all public health facilities in the province to assess whether sufficient TB infection control measures are placed. Now we go for accountability by Ndivuo.
So this is the final stretch. The last group of issues are on accountability. Clinic committees are meant to ensure community participation at a local and district level. They are key to ensuring accountability and a successful AIDS and TB response. Of the 135 sites monitored by Ritshidze, 73 have a clinic committee. It is critical to ensure all sites have a functional clinic committee in place that understands its roles and responsibilities accordingly. AIDS councils give civil society a way to have a say in the provincial AIDS response. It is critical to ensure that AIDS councils are functional and responsive to the realities we face in our communities. The councils should meet every quarter to discuss the AIDS response. However, just having meetings is not good enough. People have to make sure that these meetings are used to catalyze a more effective response to the HIV and TB epidemic in the province or in districts. To make best use of AIDS councils, PEPFAR, South Africa, should be providing quarterly updates at all levels through the POAD data. We're going to now move on to our recommendations with the chairperson.
The recommendations are, by end of May 2022, 100% of primary healthcare facilities should have established and functioning clinic committees that understand and carry out their roles and responsibilities. Linkages must be made between clinic committees and ward, local, and district AIDS council, given that the implementation of HIV policy occurs at primary healthcare facility level. Within PEPFAR priority district, PEPFAR must be required by the National Department of Health to share their monitoring data progress with clinic committees and AIDS council in order to ensure a better flow of information and ensure better accountability. So this is the end of our presentation. We'd like to thank you all for being here and be with us until now. I know that it was a long presentation, but I think it worth it. So without wasting any time, because the HOD has to leave for another meeting, we will give him a chance now to respond. And then after that, we'll go to partners and the district. HOD?
Sanibona. Lekhaya. Okay. Kube ngisasikhumbula isivenda akabe nginibingelela ngaso manje bengizobona kuzophendula bani. Oh. Khona wazi ukuthi ndakuphela uqedile. No, asibonge these sessions ayasisiza. As a department kuzosinceda kakhulu. Ngiyabona ama presentation namhlanje maningi. Silapha eMlazi. What section was that? Uphi the last session ka TAC. Kavi. Cha iyaba yodwa presentation. Manje ngibona ngathi maningi na presentation kodwa ke namhlanje for iTheku ukhona usisitosile from the district. Uzoyithatha ezeTheku. But I'm happy ukuthi information is not only coming from one district, but it's coming from different districts. And it therefore says to us, we will be able to make a strategy that looks at all clinics in the province. I'm saying all clinics, not hospitals, ngoba we already have a strategy. Our clinics must function such that you don't need to go to a hospital unless really you need to go there. Sifuna ukwenza ngeindlela eziningi. Some of the things eniyirayisayo will be sorted out. Among them, lento ka waiting time, ukuthi ngilinde isikhathi eside and all that, definitely will be sorted. But ngicela ukuba a little bit on the side of being offensive on you. Not you kuphela kube nenye community khona I was going to do the same. I-health yomuntu is not dependent on the health system. Impilo yomuntu ayilele ekutheni i-system yakwa-health isebenza kanjani. Ilele ekutheni wena wenze njani. Wena uziphatha kanjani. Eyokuqala eyesibili ngiyafisa ukuthi ngathi sonke singafika kwi-stage la sikwazi khona. It's a very difficult stage, I must say. La uLetisha sefike khona. Where you judge her, she doesn't care. Because angenza example embi. Khona lento ekuthiwa pull him down or pull her down syndrome. Sike sizwe leyo nto. Yabona umuntu who pulls you down kusho ukuthi umuntu who's lower than you. Wena ungaphezulu kwakhe. Yiko ekwazi ukuthi akuphule down ngoba ufuna ukubuyisa kule level okuyo. So that confidence ukuthi ngila aka understand ngiyayi-understanda mina should be there with all of us. So that you don't get to be affected negatively yilowa muntu ongakazi ukuthi konje i-transgender yini, i-lesbian yini, i-gay yini, and all the other sexualities that are there. Kukhona abantu abangakakwazi okokuqala. Kukhona sebekwazi kodwa bavele bathuke ukuthi khona into enjalo. Kukhona abayitshela ukuthi ngizokuthandazela mntanami izophela lento. So you are dealing with a lot of people who have their own mind about this thing. And ngirong nami njengoba ngithi this thing. Yini mayuzuvuma kangaka? Now, I'm saying for some, this is new. For some, uthola ukuthi, let me make an example, a simple one. Take ingane kaGugu Dlamini. Ingane kaGugu Dlamini, uma ukhuluma nge-HIV, she wants to be an activist. But each time she speaks about HIV, she's reminded of her mother who died, killed by people who thought HIV doesn't exist. So each time efuna ukukusiza une-HIV, she thinks, this should have been done to my mother. Why was she? Yeah. So there is that trauma that people are transiting in between, and it's difficult. This speaks to the issue of HIV, TB, other illnesses, but also the issues of sexuality. Who cares what do I do in my bedroom? It's none of anybody's business what do I do in my bedroom. But the problem is, once we start to say, hey, what am I dealing with? How am I treating omunye njalo? It's not because they are judging you, but it's how do you treat a disease lo muntu afika nayo? The teaching still needs to go further. This is before ngikutreat njengoba ufike nesilonde esandleni. Because abanye ukuthi ufika nesilonde esandleni njoba nisho nje kusho ukuthi awukwazi ukupheka. It's almost the same thing. But that attitude, we're trying to deal with it. But again, on the other side, siyaguglisha ke nathi. Ngifika sengazi ukuthi yabona nje ukuthi wena you cut blood supply. Already I'm like, you nearly killed yourself. Because if that was infected, or if you touch a little bit on the glands of the penis, yeah. So I'm starting, you are here. Let me just treat you. And then in the process, educate you. There is a part that we need to go back to. One, I said your health and your life depends on you, firstly. Two, your health depends on your family or the people that are close to you. Then the community. The health system, we have one good saying here, N24. So don't think the health system is the one that should take care of you. It should assist you as you take care of yourself. That is important. But there is one thing that the health system should not do, to judge you. Now, kukhona ababalile some clinics khona uthe bamtransfer baphinde benze njana ngigcina ngezwanga ukuthi ukuphi manje, which worries me. Two, ngelinye ilanga kufuneka sihlale with sessions that speak to different diseases. Because ukuthi nombandam may not relate to ARVs. It's not always related. So there is a need for us to be educated even more on some of these things. Umthoko ke siyazana kudala naye. Ngiyamuzwa manje uyathetha ngibone ngibuka mangithi ngiyamlunguza ngibone ngobuka hayi ngiyakubona. Umthoko siyazana kudala, but there is work they used to do umthoko, which among other things was to teach some of the healthcare workers how to manage LGBTQI people and other vulnerable groups. And we want to do that. But ngicela senze kanje. There is a lady othi ngasuka clinic enseleni ngayeSikhawini ePhapaman on that video. On the day sekuphela amaphilisi sekuyimaye clinic. One, you are going to a clinic that doesn't know you. They don't know whether you are controlled in terms of your viral load. They don't know your CD4 count. They don't know what medication you're having. But uthi ngidla lawa amhlophe, maningi amaphilisi amhlophe. So you should know your treatment by name, not in a color. 2, when you are changing clinics, rather go before your treatment is finished so that they start planning. There are other things that we say should not happen. Drugs or medicines should not expire. Because asikwazi ukunika anybody amaphilisi expired. So for that to happen, we therefore try to say, in that clinic, we expect so many people. In that clinic, we expect, then there will be a stock that is a buffer stock. When you come and we are having a situation where we've given to everything, yila abanye beqala khona bathi hey ngcono safule sikunike 15 uphinde ubuye. Abanye bavele bathi awekho because siyazi ubani uzowalanda and all such problems. But I can tell you there are systems. There is a system we call SVS, which is stock visibility system. There is a system called RX solution. The tier.net solution itself, we use these systems to check ukuthi is medication there. But in some instances, you find ukuthi umufika khona nalena ke eyama rights iphinde isihluphe nasixoxeni. Hayi la maphilisi angisawathandi khona osho njalo athi umjovo ungenza ukuthi lo ka 3 months ungenza ukuthi hayi philisi hayi yabona sake sa introduce Implanon. I-Implanon, there are people who took it out because babethi ayayayi lento le sizokuthiwa no 5G njenge COVID. Hayi angisayifuni nje sengizwa hayi ngizwe kuthiwa ngayo. So you do go a certain mile, but some people will not want some of the things. Now, khona lo sisothe i-staff start iparish isliseka ngicela unginika ama-details aleyo nto because ngifuna ukuyilandela. Angithi ukuthi balithatha balesekhaya kusho ukuthi ukuntshontsha lokho ukudla imali kahulumeni. Now I must deal with it. Ngiyafuna ukuthi ngikuthole sis, asingijustify ukuthi hayi ngifuna ukukuthola ukuthi naku bayakwenza kule clinic, then I take it, we deal with it so that it doesn't happen. So yiko ke ngithi ngiyayifuna ukuyithola leyo nto. Khona othi ngavuma ngoba kusho udokotela. Try as much as you can to understand your health better than even the healthcare worker that is treating you. That is your responsibility. There are doctors who have been treating ingane for many years. When you give them to adults, they still have to remind themselves on some things. And that adapting takes time, bangawenza ama mistakes. So know yourself better. There is a stage where we discussed giving people 6 months supply of treatment. Khona usisothi ngaye eGoli, ngabuye eGoli, bangifake room 5, bangifake room 6, that shuffling in between. Omunye uthi ama results ayethathiwe and all that. You have a right to ask questions mewulapha. You do have that right. It's difficult in some instances because amanye ama-nurses you are saying uzwa kune-attitude bengidlula kakhe nje manje ngeke ngisakwazi ukudlula. It's one of the clinics that I used to like ngisasebenza ePrince Mshiyeni. Very well run. Angazi angakade ngagcina ukungena kuyona. Kusenjalo. Ananga wakhona ukuthi kusenjalo. But kukhona amanye ama-clinic where you find problems. Le khuluma ngo-Isibhumi ngizoye Isibhumi. But here is a problem. You are mentioning umntwana and yourself. Most of the time, bazali, and your children who are on ARVs, you hide this information from the children until a time abanye benu where when you try to explain ingane be rebellious. And that gives us problems. Enye ingane ikhule yazi ukuthi amaphilisi amaphilisi mayifika esikolweni bayitshela abanye ukuthi amaphilisi HIV. Then you start to conflict. So these are issues that we are dealing with what we are asking you is, it's a very difficult topic. Umungangibuza ukuthi kanjani nami angazi. But a way should be found of making sure that children do know their treatment. We are speaking 95, 95, 95. When you look at that for children, we are far behind. And that is because the children don't get to know what's happening, but when they transit to be adults, again we have another problem. So there are those issues. But we do still have people abathi ngine HIV, why kufanele kube yimi ngedwa. They are still there. And we're having that as a problem. So we need to sort all those things out. Kodwa ke, I'm not here ukuthi ngizophendula. Bengizosho nje ukuthi menyiwe nathi njengomnyango, ngacela i-district ize, eyeza ikliniki, ngathi ngangathembisa konje bazofuna ukungithethisa ngoba ngathi ngizoza. Ngiyibona incwadi ukuthi anishona ukuthi MEC vele nathi nje ngqo. Ngathi ngcono ngiyizele ngingathumeli ngoba benizongithethisa. But engifisa ukucela ukuthi HIV is not you. TB is not you. When you are at a certain age, you also have other diseases. What is important is how you live. Secondly, that you've got HIV, abanye, they still don't understand HIV and they will want to discriminate you. It's them, it's not you. So do not be fearful or then uzvalele ekhoneni wena ngoba uthi bayangicwasa. It's because they don't understand. So put that aside, go for your treatment and leave. There are many, in fact, the statistics you're showing of 95, 84, is it 8? I can't remember. On the third pillar. That statistic, it may not be very correct for our province. Because there are people who are getting medication from the private sector, never record that they are positive. Never record that they are well controlled in terms of the viral load. So given that, there are many people who are HIV positive, there are many people who've got TB. But there is one thing I've shared in one area. Because bengikhuluma ngesigisi nesiZulu angiqhubeke lapho. There is no black man that is equal to a grant, whether it's 350, 400 or whatever, there is nobody. So this notion that I deserve a grant and therefore you don't try anything for yourself is just belittling you like window yokongezelwa. Black people should get out of this mindset to which you will get grants every time. For me to live, I must get a grant. For me to get them a grant. That we should go out of. Awuyitshalele engadini, ifike grant fine, but you are doing something for yourself. Awukudayisa something, ifike grant, but you are doing something for yourself. You can't be blaming the government and every time you wake up, you sit and wait to blame for the government. It doesn't make sense. So we need to do things for ourselves. We need to try. It's assisting we are trying to create ukudla for yourself, but also you are doing a second thing, we are exercising, which some of us don't do. Secondly, akekho umuntu oke wafa because akazange aphuze utshwala. Khona okhalayo ngale. Ngathi umthoko futhi. Kulula umsuka umthoko. Akekho umuntu has died because akazange aphuze utshwala. So I'm saying to black people the second thing, stop this thing of thinking the best life is when we are drunk. That's the nonsense that is making us go back to where we don't want to be. Akekho umuntu oke wafa because ngicela mawukuthi mhlambi khona ngicela ukumba 100 rand oke wafa because they never had sex. Khona ngiphendulayo kodwa akafuni ukusho. So guys, I'm saying this because we are seeing 10-year-olds, 12-year-olds being pregnant. And it's unlikely that a 10-year-old is impregnated by another 10-year-old. It means there is someone like Kanda, because if we indoor tungaga, ulala a 10-year-old, we are sick in the head. And that child becomes pregnant, so we are creating amapara by ourselves. So these are issues that we need to speak to. Now, can you see, Guti, this has nothing to do with health, but it has everything to do with your social life. So correct your social life. Some of the things correct by themselves. We are taking all this that we are saying. There we are having some strat plans that we are doing with a view of saying some of the things we are doing, the CCMTTs, the clinics, the other happy hours that they have are working much better, so that when you come, you really are there. There are very few men or males, men and males. You've got what is called a prostate. Ayahlupha amadoda mawuthi awaya clinic. Ngisho nina angizange isho mina. Now, guys, you need to check on yourselves before you get sick. Don't allow yourself to be sick before you then go and consult. 2, guys, a woman and a man are just equal human beings. Akusinto yokushaya umuntu wesifazane. But I'm saying, guys, there are things that we spoke about a little bit when it comes to the violence part. You know that contact tracing, that index patient thing? Some I have difficulty even going back to say, one daughter, I was at the clinic and I was told I've got a sexual transmitted illness. So you need to go. Because it's as if I got it from me. Now I'm telling you I got it, but I got it from you. And when you have a relationship where it's toxic, you always have to bow. You're not in a relationship, you're in a slavery situation. So go out of there, no one's going to die. Angime lapho ngoba bengizobona khona kodwa eli Stu kusekhona indawo kuthiwa kusemasokeni. Ingithusile le. We asked long ago ukuthi we should stop discriminating. You see, even some of the clinics that were HIV clinics were doing away with them. Because bekwaziwa ukuthi mawungena kulowa mnyango kuthiwa ilaba. So we're doing away with all that, so that everybody gets to be treated as they deserve, irrespective of who they are, irrespective of their sexuality, or any of the things that can discriminate them. So it's important for us to do that. We are going to continue to do it, but nani kubekani ukuthi long nisikhuthaza nje. Ngonihleli phambi kwenu usisi uyizwile indaba. We are going to pass some of the messages and we are going to make sure we improve every time. Siyabonga kakhulu. Ngiyaxolisa, I have to go to another meeting, so namhlanje ngeke ngihlale for a very long time. Ngiyabonga kakhulu.
Thank you very much, HOD, for that response. Yeah, I think after this also you'll allow us to have a meeting so that we'll discuss this further. The recommendation, especially with all the districts that are mentioned here. Can I be borrowed a time? Mthokozisi, cela a time, baba. Yes. Cela ningilalele. Kunomsindo ngapha. Yeah, so thank you very much, HOD, and Simpiwe and Uspe and others, they will follow up with that meeting to discuss some recommendations on how we are going to work on that. So without wasting any time, I will call for partners to have their inputs. Unfortunately, others, they couldn't make it, but we have two, which I will start with Nelly from National Association of People Living with HIV.
Sanibonani. Ninjani? Siyaphila. Thank you very much. Kubo bonke abakhona uku-attenda namhlanje. There's a lot have been done. Kusekuningi okumele kwenziwe. Ngithanda uku-encourage thina nabenzi bomsebenzi nezimpilo zethu ukuthi there's something that is called behavioral change. If bethi bazotraina thina, ake siyenze back and forth. Ake batraine thina, nathi siphinde sitraine bona. Because there's only one thing we can do. If singasebenzisani, ukhona ongeza uphatheka kahle. But if sisebenzisana, sihamba sonke ijeni, put me zifake ecathulweni zami. From 2001, ngiba HIV positive. Kodwa mangabe ngifika ekliniki kusekhona umama hayi ke ntombi uzotsho uyithatha phi nje ubungaka uyabona uyayibona akazi ukuthi ngihamba nobani or ngihamba mhlambe nekhehlana lami or uBenten or whoever kunikudeka that program ye behavioral change and we need our partners ukuthi enze more ama trainings like parenting training sinikwa uDSD like basic HIV and AIDS sifanele simnike uDOH but those programs agcine ngafikanga kuthina kugcine kufike kuthina ekutheni wena ngoba usu HIV positive usuhlala ekhoneni you are sick no asiguli lapho khona siyaphula what we need ama programs to support us. We need our programs as capacitate ukuthi to even thina supported. We need care and support. As much as sithola kuthina masisodwa, we need to review those things ama support groups. Ingathi yofika ku adherence club ingaqalanga ku support group because isalile la endleleni. Yes, they take our projects esifika nawo esisiwaqalile bawa upgrade but ba upgrade angisho ba or ba integrate sibongile mphathi wami bawa integrate it was a support group bayenza adherence club but that adherence club abasakwazi ukuyimonitor sebegijima bayothi pick up point angisho bayamshifta iblame. They don't need to shift the blame. They need to let us run le ndlela esikwazi ukuyirana ngayo because there is a healing support group. I need to heal if I'm HIV positive before I can go out and make somebody heal. Because ave kuwutwayilo wami ngedu HIV nomunye khona la kulomkhundla lozonginika amaphilisi nayo njalo. Only thing walanda private. Naye usayelwa istigma sakhe ukuthi ngabuya ngibona inkosi ukuthi nami ngiyawaphuza. That's reality. But if we see a support group, we need support, at least we need our churches, our pastors, they need to be here. We need to run this journey, all of us together. We need everybody in our community, we need to focus with journey saving lives. We need our departments but step up. But she recommend working together. Let's save lives, not to discriminate. Saki emhlabeni sakhile. Yazi ukuthi sakhile la. Yazi ukuthi sakhile ngisho standard tone ngisho la sakhile. I-stigma siqala ngo-internal. Ngine-denial. Internal stigma. Need to go healer, support group, but support group yenziwe adherence club, which does not exist. If that thing does not exist, which means mina engqondweni yami ngiyofika ngiyabhukuruza ekhaya yonke into ngine-anger. Understand what I'm saying? I hope la sizofika khona when we go back to our places, we need to sit down with our departments. We need to call every partner. Or to partner mina ngiya-implementa in this area ngenza 1 or 2 or 3. And then they need to sit down and work with us. Even a clinic, mabethi ikhona support group iphi ihlala nini. You don't, clinic I own nurse ilokhuzane support group i-ownwa yithina. It's why thina sikwazi ukuthi we meet together, ngizoyigcizelela ngisengivala ngithi lega one home, one garden. Guys, asithenga ama-veggies siyawalima. Ngiyanicela. Ngibonga mphathi.
Asibonge Mamneli. Sizocela manje uMzamo Zondi from Treatment Action Campaign. Siyabonga kakhulu Mamneli.
Amandla awethu sanibonani nonke. We have a few issues as the Treatment Action Campaign. One is that we are worried that healthcare is inaccessible in rural areas. Since people are being serviced with mobile clinics that comes once or twice per month. And people cannot wait for a mobile clinic that come once or twice per month, which then now translates us to say that people only get sick twice. And we are also worried as the Treatment Action Campaign about the EMS services who are not coming. As much as we are committed to engage with SAPS to make sure that they accompany ambulances when they are being called in communities. But we are worried that when we walk around the street, we see so many ambulances. But when you call for an ambulance take more than 5 hours to come, and sometimes don't come at all. And it's very worried, We're also worried as the Treatment Action Campaign that some other political parties, because HIV is deeply a political issue, and access to quality healthcare services is deeply a political issue. We are worried, therefore, as a Treatment Action Campaign, that many political parties are not committed. We saw something during the elections that they were doing door-to-door, asking people to come and vote for their organizations, and also asking them now after the elections to join us in the fight against TB, to join us in the fight against HIV. And we're also worried about the critical shortage of human resources. And we are calling on the government to address this as early as possible. While we acknowledge the more than 15,000 people of which their contracts were renewed until March next year, then we are saying to the department, by March next year, they need to full-time employ those workers who were employed during COVID, and others were employed to deal with COVID, and others were employed in the time of vaccination. We are calling the department to employ those workers full-time. And one thing, but last, there is a link between gender-based violence and HIV. Our attempts to arrest these barriers and our attempt for a dignified quality healthcare services, access to dignified quality healthcare services, will be undermined if, as a collective, we don't address the issues of gender. So we are calling on all of us present here, including department and other partners, to say, let us work as a collective to also address issues of gender. Thank you very much.
Without also wasting any time, may I call for person from the district, Umambambo, to respond to our community concerns. Mambambo.
Sanbona, it's not much that I'm going to say because HOD was speaking on behalf of the department and the district is part of that department. So everything that he has said, we are committing ourselves as a district, and also as he has indicated that in some of the issues that were addressed and also the facilities from eThekwini, we are going to look at that, and we also will address those issues. And also what is important is that we work together, sisebenzisane, because a department cannot address all the issues by itself, but it needs a community, it needs non-governmental organizations, ukuthi kubanjiswane ukuze kukwazi ukuthi siphumelele sonke siye phambili. And you find that some of the issues are social issues that needs to be addressed at a community level, and they need our stakeholders, which also include OSS, our war room, and other departments to address those issues. And also our leaders from the community to be also engaged at so that we can also improve in the services that we are providing, and also to improve in our health issues. And also kukhona some of the issues that are addressed by the outreach teams. That's why we are having our ward-based outreach teams that goes out in the community, so that they can also assist in teaching out there in the community. And also what we are also trying to bring to the community, that there should be the household champions, so that they can also address our issues there at a household level. And also umagune information that it needs to go to the community health workers, that person could also take it to the community health workers. By in short, what we are saying, we are committing to improve, because these engagement and also these assessments and surveys, they also brought to our attention, so that we can be aware of other issues that we are not aware of, and we can assist each other to improve. Thank you.
Siyabonga Mambambo, sibonga kakhulu. Manje sesizovala. Ngizothanda ukubonga wonke umuntu obekhona ngaphakathi, and also thank everyone who has joined us online. We really appreciate your presence, and also thank the Department of Health from the district level or from the clinic level to the provincial level for coming on honor the invitation, and also note that you are willing to work with us. We always say together we can do more. And really, when we work together, we can manage to close most of the gaps. And most importantly is to respect each other and appreciate each other and understand each other in our different backgrounds and way of presentation. So in that note, I would like to thank everyone. I know maybe there's lunch. yeah, there is lunch. I think the logistic teams will guide to say where is lunch, and those who are traveling back home, travel safe. And also, yeah, they'll make sure that you arrive safe at home. Thank you very much. Take care, everyone. Let's keep safe. COVID is not yet over. We still need to wear our mask correctly, sanitize, wash our hands, social distance, so that we don't lose anyone. But also, what is most important, let's go and vaccinate. Thank you very much.